Good morning. For anyone who doesn't know me, my name is Stephanie Johnson. I'm the Director of Health for the Farmington Valley Health District. I feel like this is my big party to say hello to all of you because I was officially appointed on December 3rd, so this is our first big event. Very excited about it. So our district proudly serves 110,000 residents within the Farmington Valley, and of course there's also all the individuals that come to our community to work and play. Our towns include Avon, Barkhamsted, Canton, Colebrook, East Granby, Farmington, Granby, New Hartford, Simsbury, and of course I can't forget my own town, Portland. So thank you all for being here today. I know that all of your time is very valuable, and we greatly appreciate you coming to discuss this important topic today. I'd like to extend a special thanks to Jennifer Bennett. I'm not sure where she is in the room. There she is in the back. Thank you so much to Jennifer and the town of Avon for graciously hosting us in this beautiful senior center. Just a few quick housekeeping items. There are bathrooms in the foyer when you first came in. There's also bathrooms through this door here. We have refreshments both on the table and over on the side table, and there's a water cooler. Please help yourself. So as I mentioned, I'm very pleased to welcome you to our first Health in All Policy Summit, where we've come together to focus on the critical issue of food insecurity. This is a complex issue that touches every one of our communities. So to help set the stage for today's discussion, I'm going to turn things over to Jamie Dudiak, who is really responsible for this event today. Jamie is our Community Health Associate, and she brings together a background in both social work and public health. And her passion for advancing equitable health policy and programming has been instrumental in shaping today's event. So Jamie is going to talk a little bit more about why we're here today and what we hope to accomplish. So thank you very much.
Hi everyone. Thank you all for being here. I'm so excited to have you all and have some really good conversations. You all bring something very unique, all your unique perspectives, all of your experiences. We have a whole host of different professionals in this room, so I'm so excited just to hold this event and have you all talking about something that touches a lot of families. So a little housekeeping in terms of the agenda. We're starting, of course, with the opening from FVHD, and then we're moving into two panels. So we have a lovely set of panelists with us today. And so the first panel is really discussing, what does food insecurity look like in our communities? What does it look like in the Farmington Valley? What does it look like in the state? And, what are some of the barriers to families really accessing these things? After the first panel, we're moving straight into a Q&A for that first panel. And so if you have any questions, please write them down, hold until the end of the panel, and then Stephanie and I will be walking around with wireless microphones to ensure that all of your questions get answered. Then we're moving into a quick break where you can look at the resource tables in the back, get your refreshments, that sort of thing. And then moving into the second panel where we have local community organizations, state advocacy groups really talking about, what are the innovative solutions being brought up to address food insecurity? What's working in our towns? What is maybe missing from our towns? And then after that, again, another Q&A for those panelists. And we are moving into a brainstorming session. So on your tables, you'll see that there's a discussion question packet. These are questions we're really just trying to lead you all to think about, to digest when it comes with the panels. Because, what our biggest goal here is really having you all bring actionable strategies, as small as they can be, as big as they can be, back to your communities. And then, of course, we're wrapping up after that, doing a quick summary of what we learned today and what we plan to do in the future regarding food insecurity. So the Farmington Valley Health District, what our role is. As you all know, we are the local health department serving those 10 towns that Stephanie mentioned earlier. And so really what we are is a local health authority for our towns. We are a resource to our town leaders, our town managers, our town councils, our community organizations, and of course our residents. And so really what we want to reinforce is that we are a resource to you all. We are a resource that can help inform policy, can help inform programming, and can help inform all of these things with the various subject matter expertise we have in our department. So many of you know we have a lot of regulatory standards that we follow, inspections, so on and so forth. And then we have the community health side where we really look at the social determinants of health that you'll see on the right in this slide. So a few years ago, we did our community health assessment, which really looked at all the data, all the health data that exists in our community. What is the health status of our community? What are some of these different health indicators? And so through that, we created a community health improvement plan, which we developed last year. And I will go a little bit into that in a second. And then bringing you all here today is really talking about health in all policies. So what does that look like? What does that mean? Of course, there's policies that happen at small levels, whether it be schools, organizations, and then larger levels, so towns, largest levels, states, and the federal. Policies that impact health, obviously. But we don't often think about the policies that aren't so explicit in addressing health, but have a health aspect. That's really what we want to do as a local health department, thinking about the policies that you enact, whether it be in the towns or in your organizations, what is the health impact of those? And so if we're thinking about food system policies, that's a clear one, right? If we think about the way that the food system works, that has an impact on obesity, on overweight, on malnutrition, that sort of thing. But then we think about urban planning policies, walkable neighborhoods, green spaces, affordable housing. How does that impact health? These are really the questions that we intend to get at when it comes to our health and health policy summits. And of course, today we're focusing specifically on food insecurity. So our community health improvement plan and our community health assessment, we really found that there's 4 priority areas that we wanted to address in our 10 towns. One of them being healthy eating and active living, mental health, optimal well-being for older adults, and emerging environmental health concerns. And if we think about food insecurity, right, it really plays a role in all 4 of these things. Obviously, healthy eating and active living, there's barriers to those things when it comes to food insecurity, but food insecurity can impact a person's mental health. It obviously impacts well-being, especially for our older adults. And if we think about the food access system, emerging environmental concerns, how are our farms faring? So that's just me trying to emulate that. There's a lot of ways that health plays into these things. So just a little bit of level setting. Food insecurity, as the United States Department of Agriculture defines it, is a household level economic and social condition of limited or uncertain access to food. While hunger is that physiological condition, right? It's that condition that may resolve from food insecurity. It's a symptom of food insecurity. The panels will go into this a lot more than I will. So I'm sure you are all begging to ask, what does this look like in the FVHD? How are our 10 towns impacted by food insecurity? And so through preparing for this summit, really it was about gathering the data for this. So on your tables, you also have a data handout. This has all the data that we gathered, whether it be from Connecticut Food Share or the census or key informant interviews we did with community stakeholders about what this looks like in our communities. All the sources are also on that data sheet. And so if we think about what food insecurity can look like, we have 110,000 residents, okay? So 1 in 20 of those households receive SNAP benefits. Those are the people that qualify for SNAP benefits, right? They're meeting that federal poverty guideline. 1 in 10 people are considered food insecure. 1 in 5 students are eligible for free or reduced meals, so they're also fitting that eligibility criteria. And something I want you to pay attention to is that 1 in 4 households in our district struggle to make ends meet, okay? So when we think about the ALICE threshold, which is the Asset Limited Income Constrained Employed measure, right? These are the people that don't qualify. They don't qualify for government benefits because they don't meet that poverty guideline. but they can't afford the cost of living in their towns. So it's that middle ground, right? And that is a lot of people in our district, okay? Just keeping that in mind. And then on the left, you see the quotes that we gathered from our key informant interviews, which really helped inform this event. We see people dealing with medical debt, disabilities, domestic violence, addiction, or caring for multiple children on one income. What we really see a lot of the time are qualifying events that people go through in life as life throws its lemons at us that really make it hard for, or present us with challenging times, right? So if I have a job loss, if I have a family member pass away, if I have an eviction, all of these things can lead me into being food insecure. And so what we notice a lot of the times with people who are food insecure, they're stretching their funds to afford rent, to afford car payments, and they're missing a meal because they need to supplement those things to survive, right? That's really what food insecurity can look like in our towns. Okay, so moving into the panels, you have programs in front of you that have all of the biographies and names and pictures of our panelists. So as we go through the panels, if you have questions directed at one person, please refer to that. So, of course, we have some very star-studded speakers. We have Connecticut Food Share here, and Hunger Connecticut, our local organizations like Waste Not, Want Not, and Healing Meals. We have Representative Eleni Kavros-DeGraw, the Yukon Red Center. And we are so happy to be moderated by Christian Dubourg from, I'm looking back because I cannot remember the name of this acronym, Commission on Women, Children, Seniors, Equity, and Opportunity, which is legislatively appointed. And so we are so grateful for him. He does a lot of work in the state regarding food policy and really helps inform our legislators what the landscape looks like and produces public-facing documents that inform legislation. So without further ado, of course, thank you for being here, and I will ask my panel to come up here. And we can clap.
Alrighty, good morning, everyone. Thank you so much for coming out. Real quick, huge thank you to Jamie and Stephanie and the whole Farmington Valley Health District team for having me here today. My name is Christian Dubourg, and what that very long acronym up on the screen means in practice is that I am a nonpartisan staffer to the Connecticut General Assembly, and I advise all elected state legislators on food and nutrition policy. And as someone who recently just got done writing a 71-page report on the state of food insecurity in Connecticut, I can safely say that it is a very, very complicated topic. And because it's such a complicated topic, there's a lot of myths and misconceptions that I think can often surround it. And so the first question, in addition to asking you to briefly introduce yourself, the first thing, since we have a great panel of experts here today, is I wanted to ask each of you to just briefly share, along with your introduction, what is one myth about food insecurity that you encounter in your work that you think everybody should know? And I'm going to start with Leah, and we'll just go down the road.
Good morning. How are you? Hope you're well. My name is Leah Konechny. I represent the Community Voice. I'm a 48-year-old single mom. I homeschool my child, who's 8, who's here with us today. And I am very thankful that I participate in the Simsbury social services. I'm very thankful for everything it's brought to my family. And the myth about food insecurity that I would like to share is just education and perception of, and choice, really. Choice around diet, food, all of those things. And while navigating the pantry, and my choices, my family's choices with food, again, it's just around that. So I think that that's my biggest myth that I would like to try to open up, expand.
Good morning, thanks for having me. Thank you for being here. I'm State Representative Eleni Kavros-DeGraw. I represent 3/4 of Avon and all of Canton. So this really is my backyard, and I have worked on the issue of food insecurity for most of my adult life. And I can remember being a kid collecting chunky soup for various food drives. The myth that I think I would like to address is the fact that not only do people think that people who are experiencing food insecurity are unemployed, but that by having a certain zip code, you are somehow exempt from being someone who is experiencing food insecurity. So I think that the group here, you can see your face. I think that the group here probably didn't, that's not something that you think is a myth because you are working in this space every day. But I think it's important that that is something that we continue to talk about, is that these folks are often people who are working, who can't make ends meet.
Hi everyone, my name is Miranda and I work at Connecticut Food Share. I'm our Senior Director of Network Relations, which means I get to work statewide with food pantries, soup kitchens, and shelters. Some of you might know my colleagues Ben and Kristen who are here, who work more locally. And I would say, I echo what you said, so I'm gonna share a different one. I think there's a misconception that food pantries can handle it all, that we have charitable food so the problem is fixed. And we know, I think many of you in this room who run food pantries and kitchens, you know charitable food is not enough, and many of us would wish that people never had to go to a food pantry for help with food. We want to make that experience as easy, as welcoming, where people have choices, but we know it's just a Band-Aid solution. There's deeper issues at play, and there's policy solutions to all of this, that we all have a part. Whether you're experiencing food insecurity, whether you're serving, we all have a part in finding the solution.
Sorry, can you guys move your mics just a little bit closer?
Hi, I'm Caitlin Caspi. I'm from the Yukon Red Center for Food Policy and Health. And so I do quite a bit of research about food insecurity and working with charitable food programs like food banks and food pantries that serve people who are experiencing food insecurity. And I think the insights that have been shared have been excellent. And I think Jamie set us up really nicely as kind of pointing out that the scope of the problem, that this is not really a small portion of the population that's potentially at risk for food insecurity. And so in the same vein, I wanted to say more about kind of how the needs and preferences and food choices of people who are experiencing food insecurity are just like everyone else. When we're thinking about donating, we're thinking about providing food, we should be thinking about people with food allergies, with certain medical needs and preferences. And in my research, we've done quite a bit of surveying of people who are using charitable food assistance programs. And there's kind of this myth that people don't really want healthy food or they don't know what to do with it. But when we actually ask people what they wish they were getting, and when they're visiting, like say a food pantry, we get really clear and consistent. We've done these kinds of surveys multiple times over multiple years in different geographic locations, and consistently we hear that people want healthy and staple foods because those are the most difficult to get out in the community, and they tend to be more expensive. So things like meat and dairy and fruits and vegetables and eggs and cooking items. And so we shouldn't overlook that. And kind of make generalizations about people just wanting convenience foods or snacks, particularly when we're thinking about donating and supporting these organizations.
Thank you all so much. And I think as every one of you was talking, the thing that just kept coming up and up in my head was that people experiencing food insecurity are our friends, our neighbors, our families. They, in pretty much all the important ways, are just like us. They have allergies and restrictions. They have, they prioritize choice. They work. All of these things that we do. And I think that is really, really important to emphasize. And moving into a bit more of the day-to-day, and Caitlin, I'll start with you this time and come back down. What are you seeing in your work in the day-to-day of what food insecurity looks like in Connecticut right now?
Well, I'll say that there's a lot of challenges right now that are coming from changes in policies that affect food assistance and the support that people can get. And that's putting a strain on food banks and food pantries. And so you have kind of a little bit of a perfect storm of challenges going on right now. And so I'd say on the day-to-day, what we're hearing is that the need for services is growing at the same time that some of the supports are either there's threats to how they're going to be getting enough resources, or there's threats to the programming. I think that November really was a point at which people were talking about food pantries were really and food banks were really getting the attention they needed, because they were filling this role when there was the threats to SNAP benefits being issued on time. And I think that we're up against potentially something similar in January. So the problem didn't go away now that the government is up and running and those benefits were issued. And so I think that these conversations are really happening around where is help coming from, given both the increased needs that we're seeing and the challenges in supplying food.
Well said. Very similar to what I would say. I can paint a little bit of a picture on what Connecticut Food Share is going through right now and how that impacts communities right here in Farmington Valley. As you all know, Connecticut Food Share is a statewide food bank, and we're really being impacted by changes that are happening at the federal level. Connecticut Food Share gets the food that we distribute to food pantries. Some of you are in this room, in kitchens, in a few different ways. One of those sources is through the federal government through a program called TFAP, the Emergency Food Assistance Program. It's a USDA program where the federal government invests in U.S. growers to then produce food specifically for food banks and food pantries. That program is less stable than it has ever been, and we have seen a 50% reduction over the past year in the amount of food we're getting through TFAP. What that means is last year we had 35 truckloads of food canceled that were meant to come to Connecticut that we didn't receive. What that means is less food available for food pantries at a time when everyone is seeing increased demand. Cost of living, cost of groceries, we're all feeling it, it's on the rise. What we hear from providers in the area is that they're seeing more people coming through their doors. Maybe someone hasn't been in a few years since the pandemic, now they're coming back. Maybe it's their first time coming and asking for help because they just can't make it all work. Or maybe they've been coming to the food pantry and the food pantry is part of their regular day-to-day, how they make things work, but their need is deeper now. That bag of food they used to get from the food pantry isn't enough anymore. So we're kind of facing the situation where the food supply is more volatile and less stable than it has ever been at a time when we are facing unprecedented demand. And it's not just that people need help with food, people are in really difficult situations. So food pantries are having to work like social workers too to make sure we're connecting people with other resources. And then for our neighbors, the fear that came out of what happened in November, knowing that this important program, SNAP, that allows me to go to the grocery store to get the food I prefer, it can go away like this at the hands of something I have no power over. So all of that comes together. It's made for a really stressful time, and I know many of you are probably feeling that. And I'll also just add that we're also seeing changes in the donations we receive. Food banks and food pantries started in the 1980s because grocery stores had extra food. There were inefficiencies in the food system, so we were able to rescue that food and get it out to people so it didn't go to waste. As grocery stores, farmers get more efficient, they have less waste, and that means they have less food to donate, less meat to donate, produce, things that we know people really want. So it's a really ever-changing environment. It's going to take all of us working together to find solutions.
And I would just add on to that before I give what I see in my daily work. Food is the canary in the coal mine. You know, if you were starting to have food insecurity, then the next thing is your housing it becomes less secure. Obviously, we hear about people all the time who have to decide between food and medicine. And food is medicine, right? But also their actual physical medicine that they pick up from the pharmacy. And so But we are seeing more instances where people started out food insecure and then they become housing insecure and then they end up homeless. So this is, a growing concern of ours, especially at the state. I would say that 2 years ago, I and my colleagues, I filed a bill, and some of my colleagues in the room, Senator Honig, Senator Slapp, Representative D'Amico, we were all co-sponsors on a bill to get Connecticut Food Share $10 million for the CT NAP program. So that's the Nutrition Assistance Program. That money can only be used for food, not for administrative costs or anything else. The reason we went and said $10 million was frankly, that was the need 2 years ago. And it was more in line, frankly, with what our surrounding states were doing for their statewide food bank. And we were only giving around $850,000, I believe was the number. So that seems like an incredible increase to go from $850,000 to $10 million. But that just represented where the need was, and that was 2 years ago, and the need is so much greater now. We were able to secure $3 million for fiscal 26 and then $6 million for fiscal 27, and that's great. However, the need was really the $10 million. So when we talk about, again, the charitable piece of this, the state, the losses at the federal level, we cannot as a state possibly get us out of those federal losses in terms of dollars. We can do as much as we can, but we can't actually get us out of those 35 lost trucks. And charity cannot get us there either. It's not physically possible to, we have so many generous people. I actually worked at Food Share before it became Connecticut Food Share, when it merged with Connecticut Food Bank. I was part of the major donors team. And I can tell you during the pandemic, it was phenomenal to see how people stepped up, but it was also very different circumstances than we are seeing now. We have an economy that for many people is struggling. People who do have a lot of money, I'm sure they engage in charity, but maybe food insecurity isn't their issue. And so we have to be really mindful of the fact that this is going to take everyone trying to help solve this. I would also say something else I see, I wouldn't say daily, but every other week, knowing the numbers at the Food Share mobile truck here in Avon, those numbers have gone up significantly, and it didn't really abate after SNAP came back online. And now we have to worry about whether or not SNAP might disappear again at the end of this month, or if there will be other federal consequences coming our way that may adjust, eliminate, etc. what is going on. And so we are in talks about even having a state SNAP type program because of it.
So the day-to-day for me is, what comes to me is pivoting, and that's what I learned within the pandemic during that time. You have to just constantly pivot. I mean, budgeting is not the same. I used to be able to budget. I've always budgeted my way through life on a very small paycheck. Because I choose to live my life a little bit differently. I kind of swim upstream, but I'm proud about it. But it's become really hard. Mortgage is really hard to make. Food insecurity, going to the pantry monthly has become a little bit different. The choices are a little bit less because I choose to pick organic beans and certain things. We don't do food dye in our house. I just have certain choices around food. But I still make my choices at the pantry because I know I need them. So we navigate, that 80-20 split between diet. You gotta live a little. You have to have a little joy. You eat a little cake once in a while. But yeah, it's hard. It's hard to be vulnerable, but I am the best I can. I show up every day within my community. I access free programs at the library. I've just learned to pivot with it all. And I'm learning to educate myself as well, and in conjunction to that, educate my son. So an example being, we were in Stop and Shop one day, and he's reading the back of food labels, right? He's yapping about added sugars. And this lady said, "Oh, wow." And I was a little embarrassed because I was always, just being, but she's like, "I think that's great, And maybe he'll talk to his therapist about it in the future that I've imposed upon him all these things, but I think it's important. I've also navigated thyroid cancer, so food's important to me. I believe in medicine through food. I believe in navigating choice of healthy choices. We don't do a lot of dairy, we don't do certain things, but that's a choice and it's okay. But everything's different for everyone. So I would like to see some more education around food and the misconceptions, because with food's changed too. Diets have changed. Now we're adding protein into kids' cereal. So there's just things that are changing with trends and things too with food, and that also leads to food insecurity, because we're human and we're going through these, everyday lives of all these changes in social media and all of these things. There's so many powers of tools of communication. But yeah, it feels really scary every month to make it all come together. But I do, because of him. And because of, why not? I'm gonna speak my truth about food from now on, and I'm happy to continue with this mission, so let's do it.
So I'm going to keep my talking very short, but I have a few quick thoughts. First of all, just thank you all. What you guys are sharing is incredibly powerful. Secondly, Leah, I feel like I need you to educate me about labeling and what to put in my what I need to be looking for in the store, because that's the level of that's what I aspire to. And third of all, while all four of you were talking, I was just quickly jotting down an equation on my sheet of paper. So we have an increase in need, plus a decrease in federal supports and services, plus an increase in food prices. That does not sound like a very good equation. And that, I think the only thing that's going to result in is more food insecurity. And to your point, Representative Cavaros, that things were bad before all of this started to happen. My job was created 2 years ago, and we had a lot of need then, and we have even more need now. And so there is a pretty substantial challenge facing us as a state and as a community. Speaking of those challenges, and Leo, I'll start with you this time. If wading through all of these different challenges, all these things that we're having to balance, what do you think is the biggest challenge that's facing you and your community when it comes to food insecurity? What is the biggest, most urgent thing?
Like Simsbury or, okay, thank you. Normalizing the fact that I live in Simsbury and I don't make a lot of money, but I make enough. I make a normal salary. I don't need to share it with you, but it's put Ethan in school. Sure, but then I'd have to pay for childcare, so that's just going out the window. So it's just a misconception of being a single mom within that community. I just normalize it. I just, I'm vulnerable around it. So it's just understanding that even though I make a certain amount of money and I don't qualify for everything, I still might need it, actually. My father just passed away, and he was really proud about his finances and stuff. And the one thing that I realized is that I don't need to be too proud about it. I can be truthful about it, because this is where change happens. And I'm gonna leave it there.
Maybe I'll just take a second and I was raised by a single mom, so I see this. And guess what? I turned out okay. So sometimes it really bothers me how communities sometimes respond to single moms. So I just want to say, single dads too. Yeah, single parents, period. Yes.
Caretaker,
Yes.
grandmother, grandfather.
And I would just say you are being vulnerable, but I think you're also being really brave. So it just means a lot for all of us to hear it today. I would say, to sort of piggyback on that, folks who are ALICE, asset limited and income constrained employee, that is such a misconception in terms of, I think that's one of our biggest challenges in Avon and Canton, is these folks are not qualifying necessarily, but they still need to go to the mobile pantry, or they still need to go to the food pantry. And that is a huge issue, because I think that's what I saw when I first ran. It's invisible pockets of people who are really, really struggling. And that sort of pride around not wanting people to know and feeling shame around the fact that they don't want to show up at a food pantry. I can remember running into someone that I knew when I was volunteering at the Food Share Mobile, and they immediately went into an explanation of why they were there. And I'm like, I'm just happy to see you. Like, it's great to see you today, because there but for the grace of God go all of us in many ways. And I was raised by a single mom. I was blessed with two incredible grandparents who were, early 40s and just barely 50 at the time. My mom was in her early 20s. And unfortunately, the marriage didn't work out. And so we, if it weren't for them, this is exactly the situation. My mom still had to really budget and make sure she had a good job and she had good benefits. But, when you are a single parent, it is really hard. And I look at my cousin who was in the same situation with a single mom, and they were eating chunky soup every night. He talks about it to this day. And so I think that helping these folks not only feel no shame around needing help, but making them visible in a way that makes sense, that we are really supporting them and have their backs because we are a community. I think that that's part of the biggest struggle I see in my larger district, that larger community of Avon and Canton, just ensuring that these folks are getting what they need when they need it.
Just say something really quickly. I don't want to say that I'm not thankful because I couldn't do it without the help I'm getting. So I just want to clarify it. So like any little bits is great. It's great. It's that misconception between that. But see, I don't feel bad about being like, I need a little bit more, or a little bit of food stamps would be really helpful right now, just because the budgeting was work, but now the budgeting is not working anymore, right? Everyone, like, we're all, yeah, it's just not. So it's hard to ask for more in that position.
There's so much to say.
Yeah.
I think, as you said earlier, Christian, this is a really complex issue and there's so much nuance to it. I think what you all are making me think about is Feeding America did some research on what are the barriers to getting help with food. And we know we have food pantries, but can everyone access those food pantries? And they identified 4 key barriers in talking to people with lived experience. The first is awareness. Do people know that help is available? If you find yourself losing your job, medical bills, in a domestic violence situation, do you know where to go to get help, and do you know that you're eligible for that help? So what can we all do to make it easier for people to know that help is available and that they're eligible for that help? The second bucket that they identified, which we're hearing a lot today, and I know is common in suburban communities especially, is stigma. People feeling ashamed of saying what they might need, or feeling like going to the pantry means that they're failing in some way, when really going to the food pantry means you're making a really smart financial decision for your family to make things work. And how do we flip the way we talk about it to help reduce that stigma? And knowing people might not want to go to the pantry in their town, and how do we set up systems where it's okay to go to the pantry in the neighboring town because they don't want to be seen? The third barrier that they've identified is physical access. Okay, said I'm going to go to a food pantry. Can I get there? Do I have a car? Or is the pantry open when I'm free? Can I access the building if I have a disability? And then the fourth, which is a really important one, is the experience you have when you get to the pantry. Do you get the food you need? Do you get enough food to make it worth your while? Do you feel welcome? And so those are all things that we keep top of mind, and when all of this leading and learning from the people who know it best, which is the people who are experiencing it.
I just want to add one thing to that. In November, when SNAP was down, the number one thing that I heard from people was, I use SNAP to have my groceries delivered because I can't physically get to the food pantry. And so, then you're trying to connect people. I mean, literally, I had a friend who was a state rep, someone reached out to me from Manchester. He delivered groceries to her house because there was no other way. There are people who don't have family who they can count on to bring them food or make it work. And so that access piece is really significant.
Homebound came up a lot.
Homebound, yes, over and over. And that was even the conversation with Connecticut Food Share. How many partner pantries do you have? But there are still many pantries out there that are not partnered. And so making sure that people physically have the access, that it's a huge issue, huge.
Like Holcomb Farm and Thrive Farm have brought fresh fruits and vegetables, and I'm like I was so excited for that. And that's the community. It starts tiny. It starts with your neighbor right next door. So like if I get extra food that I may not choose to eat, and I know my neighbors will, I share. Because it just starts right there. So I think like, and benefiting the farms too, I think it just starts really small. It's like a puzzle, I guess.
Yeah, I want to thank all the other panelists for bringing all of these issues up. When I'm thinking about the safety net, based on like what you're hearing, I'm thinking about like how it has to be like multi-layered and like having pressure on just one system we know is bound to fail. People are getting help from a neighbor and also from the federal government and all the layers in between, right? And to hear you say like I could just use a little bit of food stamps, right? When I something that hasn't come up yet just in this question is kind of what the prospect for SNAP and SNAP funding that's down the line. So there have been federal changes to eligibility that are likely to affect neighbors in the community. There's anticipated changes to how SNAP is going to be, the costs are going to be covered. And it seems as though the state of Connecticut is going to have to be paying more to support SNAP. And I am really concerned about that inhibiting kind of people staying on SNAP once they've gone through this whole process of being eligible for benefits, determining that they're eligible, getting onto this program. What's going to happen to keep people on the program, to sign up people and do the outreach needed to get people who are eligible on the program? I'm concerned about that, especially as Connecticut is called upon to take a larger portion of the benefits.
And that other tough piece, if you qualify for SNAP as a family and your child's in public school, then you're automatically qualified to get that free school meal, right?
Exactly.
Well, that's going away because there are a lot of people who have, having to re-up. And in November, even though SNAP was, down, people were still having to reprove that they were able to receive SNAP at the same time. And so it was like this mixed message of, well, am I in, am I out? I don't know what I'm supposed to be doing here. And then the new requirements coming in. So it really is going to leave more families, I think, in the gap because there's no connectivity there.
I'll just add to emphasize how important SNAP is. For every meal a food bank can provide, SNAP provides none. It's an incredibly important safety net that without that, there's not enough room at every food pantry and food bank in Connecticut to make up that difference, not to mention the experience of being able to go to the grocery store and purchase and get the food that works best for your family. So this is really big, what's happening with SNAP.
And last but not least, let's not forget, SNAP and WIC prop up our grocery stores. It's 15 to 20% of the dollars that come in the door for them. And we do not want our grocery stores collapsing because there is not, these amounts of money coming in. Because the prices just keep going up for everybody else as those dollars disappear.
Thank you all so much. You guys are making this really easy on me today. This has been fantastic. And while we're on the topic of SNAP, I did just want to point out, we've just heard an exhaustive list of all the ways that SNAP is so important and so helpful. But I jotted this down when Jamie was presenting. 1 in 10 people in the Farmington Valley experience food insecurity, but only 1 in 20 receive SNAP. So this incredibly valuable, game-changing support is only reaching about half of the food insecure households, and that's before all of the changes that Caitlin just talked about. So that's a really important thing to keep in mind is there's not always federal supports available, in large part because, to speak to the misconceptions, a lot of food insecure households are working and they make too much to receive any support. They make too little to easily get by. And that's how you end up in the Alice category. And then just on a personal note, I just wanted to echo everything both of you said about single parents. I was also raised by a single mother, and I think it really speaks to that stigma of we were doing fine, and then my mother was also diagnosed with thyroid cancer, and things changed overnight. And there was nothing that she could have done. And she was working and getting cancer treatment and raising me and my two brothers.
Stress.
She was a superhero, still is, but it's so much stress. And that, I think that's why that stigma piece that you brought up is so important, because there is absolutely, you can do everything quote unquote right and still be food insecure. And that's why that safety net is so important. Sorry, I'll get off my soapbox, but I just really appreciated that. Okay, so at this point in the conversation, I think we can unfortunately pretty safely say that the state of the food insecurity is a pretty significant problem for the Farmington Valley, for Connecticut. But one of my pet peeves in this job is that often when I get asked, how bad is it? How many people are food insecure in Connecticut? I have to respond, it depends on who you ask. And so, Caitlin, I'm gonna start with you if that's okay. I was wondering if you could just talk a little bit about like, where do we get our data? What do we and don't we know about food insecurity?
Yeah, so it's a good question. But I will say that for the last several decades, we have relied on a national measure and a report that the USDA has published annually that tells us which direction we're headed. Food insecurity, that's how we know that during the Great Recession, food insecurity went up to unprecedented rates since we've been measuring, and then went back down again. And it actually even stayed stable during the COVID-19 pandemic for a couple of years until some of the extra SNAP supports and other supports started to go away, and then it started to rise again. So we can tell that story because we've had these really high quality data to tell us about trends. Just recently, the federal government announced the discontinuation of those national numbers. So we're not gonna know, we're not at this point predicted to be able to say what happened in 2025 with regards to food insecurity. So that points us toward, I think that's a real problem, because to be able to measure changes and policy impacts is hugely important. So that kind of points us towards other ways of measuring the problem. And one thing that we have been able to do, and other states have been working on, is being able to use publicly available data to kind of map kind of what food insecurity risks look like in different parts of the state. So you get a little bit of understanding of where there might be the highest geographic access barriers, so barriers in transportation for accessing both food retail and visiting food pantries. So to understand food insecurity and its risks, not being able to access SNAP or being particularly low income areas. So we can get a profile of risk at the state level, but my concern is that right now we don't have a great mechanism for measuring change over time. So I appreciate that there is a conversation going on about how we're going to sort of replace the discontinuation of this national measure. It has put the spotlight on how we're measuring it, and I know that Christian is doing a lot of work and having a lot of conversations in this area, so I appreciate that. But I'm still really concerned about how we're going to be able to look at the change over time.
I would say all of that incredibly concerning because we have to have that map over time. I think about the fact that 20 odd years ago we were actually back to the numbers that we were at 20 odd years ago for children in the state of Connecticut. I can't speak to the wider nation, but I would imagine it's at least as bad, if not worse. Feeding America does correct me if I'm wrong, the title. It's Mapping the Gap or something along those lines.
Map the meal
Gap. So that's going to be really more important data as we move forward. As Caitlin was saying, the publicly available data here in the state, we have to really focus on what we can figure out here. And Christian's right, it does depend on who you talk to. So I think it's going to be important that we have sort of this statewide but hyper-local information that we're able to use to move forward, because that will inform us certainly as legislators in terms of how much money we should be putting towards this. When we're talking to our providers, ensuring that they have the resources that they need. It's concerning not to have those federal numbers, because again, you want to be able to say like, okay, well, when the numbers were this bad before, this is what we did, and this is how we were able to improve them over time. It wasn't just, oh, well, the economy improved. These were, factual things that we were able to do to actually make change and lasting change. So the data becomes even more important when you are losing a major data source.
And I'll just add, so the Macron-Milgat study that Feeding America does every year, it's based on that USDA study. They take the data that is at the state level and then make estimates on what that means at the town and county level. And Connecticut Food Share uses that data to inform our decisions on where we're prioritizing our resources. And so the loss of that data, we know what gets measured, what gets funded, right? So if we don't have that data, doesn't mean it's not an issue anymore. We know that's not true, but we need data to raise awareness and support of what we're all going through in our communities. And I think just to add, it's not just the numbers, it's the stories and the lived experience of who is going to pantries and who can't get to pantries, and making sure in all of this, we're remembering the real stories behind this.
And I would also say we have to look back at how poverty was defined in the first place and how we set the poverty level up, because, and I'm seeing nodding heads, because that really is such a significant issue. If we could really update and address how we identify poverty in the first place, that would get us so much further down the road in actually addressing root cause and ensuring that less and less, fewer and fewer people are actually needing to access these resources. But I don't think there's going to be an appetite for that for a while, and that's regardless of who's in charge. And it goes back, I think, to the 1960s, and they needed a measure. I just don't think they went in the right direction with how to actually measure it at the time. And the challenge that we're really going to be facing, like when you're talking about having parents having thyroid cancer, everyone is just this far off from being insecure because of medical debt, which we cannot control.
There we go, sorry. Absolutely. And I have so many follow-up questions, but I know we're running a little bit behind, so I will just briefly say that I'm echoing everything that all three of them said. It is so important to be able to measure this and know where the problem is to be able to deploy solutions. And I will, because you mentioned it, I'll just very briefly plug, we just put out our report on the state of food insecurity in Connecticut. I've actually got like 40 copies of my car right now or something. And one of the things that we're recommending is taking a model that one of our northeastern states, New Jersey, recently used to start measuring food insecurity and food access on their own. So that is something that I think will be really important to talk about going forward. But we have three more questions. For the sake of time, I do want to direct this one specifically to you, Leah, which is, we've talked a little bit about nutrition and knowing what's in your food and all of that, but speaking as someone who works in food policy, that's not always easy to do. There's a lot of education involved. So what, I was wondering if you could tell me a little bit about like what the state of like nutrition education is and where you go for your information.
So I've been doing this probably since college. I started working in co-ops. I went to Keene State. So I started working at the Brattleboro Food Co-op, and I started to educate myself about food choices and where they came from and how to access food, and I thought it was kind of cool. And then, I don't know, I guess I'm a data hound, and I think to know things, and so I just kind of got into it. And then, I started talking to my mom, and I've been doing this a long time, so I've just kind of studied it and seeing where the similarities are, where the false truths are around food, learning through community members. I didn't know that Red 40 was attached to ADHD with small children and how it was metabolized. I didn't know that until a nurse friend told me, and we didn't do food diet anyways. But then it really just made me think. Because with that, there's a whole then continuity of things that we go through with making choices with food. So the breakdown of food in our bodies, it's all for common sense to me, something with a lot of preservatives, right? What's it doing? It's just sitting there and it's preserved. You're gonna eat it and then, you kind of digest it and it's still preserved food. So like some of these choices with food insecurity and going to some of these places, I opt to not pick some of the food, to be honest with you, because it's pointless to eat. It doesn't do anything for your body, brain, nothing, and especially for kids. So I guess it's just a passion of wanting to heal myself through food, but also knowing that I have to participate in medicine. And that's a whole nother topic of conversation because my parents just got booted off their insurance at 80, with an onslaught of some medical stuff. But my mom, she's really healthy because she keeps telling me it was something I told her a long time ago. So now she's telling me, and I've gotten back into it a little bit more. I ebb and flow. I'm not I still have a long way to go. But I don't know, it's just through what I've done, I'm interested in it. And I want to learn more about it, but it works, and I see it with my son. So I don't know if that answered the question.
It absolutely did, thank you. And it reminds me of what Miranda was saying earlier about the barriers of you don't just need physical access to food, you need access to information to go with this. And those things will really go hand in hand, and they're both important to consider. So for our second to last question, I want to go to Representative Caparostegura. We talked a little bit about the sort of invisible food insecurity crisis that happens in a lot of towns in this region and across the state. And I was wondering if you could just share a little bit more about what does that invisible challenge look like in your experience?
So, knocking doors, 2018. I'll never forget this man as long as I live. He's a senior living in Canton. He was in some affordable housing, and I'm not even sure how it came up. And he said, we started talking about the food share mobile, and he said, oh, he goes, is that where they get the ice cream? And I said, well, I said maybe sometimes. I said, because the what's on the truck changes, every other week. And he said, oh, my friend sometimes goes there, and they gave me, speaking to your community piece, they gave me the ice cream that they got off of the truck. And that was a really hard day because I thought to myself, this man is food insecure. He'd already told me that he had to quick sell his house because of medical debt. He was living in affordable housing, and here he was receiving food sort of secondhand, but he really needed to be at that truck. Or I had a coffee last year post our legislative session, and I always mention the Connecticut Food Share Truck, and I always mention Gifts of Love and the Pantry at St. Anne's and the Pantry in Canton, and all of these places. I try to mention it at every coffee if I can work it into the conversation, because I don't know who's at that coffee who needs help that isn't going to ask for it. I try to mention it periodically in my weekly e-news, and the reason is because there's always one. There's always one. And there was a man at that coffee that day who came up to me after the fact, and he said, do you have a card? I would like to send you an email. I said, sure, and I gave him my card. And what did he email me about? He emailed me to say, I lost my job. We've applied for SNAP, but it's not moving fast enough, and I'm, like you mentioned, this truck, where can I go to get this food? And again, removing that barrier, it's like there is help. How do we connect these people to help? And I think that is that invisibleness of, especially for folks who maybe have never had to use this, and we saw this during the pandemic over and over, especially with people who had never ever had to access unemployment. It is very, very hard, even when you are in the most desperate situation, and many people wait too long, and then they are at the point of losing their home because they've had, that budgeting, trying to make it work, trying to move things around so that maybe they can get, through the month. And okay, well, they couldn't pay the mortgage this month, but they'll pay it next month. And that, again, it's not expected. And that's, I find that's the biggest piece of invisibility are the folks who just don't know and don't know how to access it, and then the shame around doing it because they may have grown up on support, or they may, this was never going to be me. And I think that all of you in this room, especially that are in this space, the empathy that you give every day to these folks is so critically important. And the fact that you are welcoming them with open arms, and I'll close with Don Piccini that works at Connecticut Food Share. Whew. Every day that we had that distribution at Rentschler Field, and we would have 1,500 people show up in 3 hours. Every day Dom started by telling us, it doesn't matter what they're driving, it doesn't matter if they're in a Mercedes, it doesn't matter if they look like they're a doctor and they're in scrubs, it doesn't matter if they're coming with a car full of kids, it doesn't matter if you open the trunk and you see a wheelchair, it doesn't matter what you are seeing in front of you. We have food, they are here to get food, we give the food, that's it. And I think that that is an enormous piece of this, is to make sure that we have the food, we need to get the food out the door to the people who need it when they need it.
Oh, that was incredible. Thank you so much. Oh, Brandon, do you want to?
Well, just thank you for sharing that. And I think a lot of us have heard, "Well, look at their car."
Yeah.
I mean, how many people have heard that in this room? I hear it often. And our job is to not judge, and it's to meet people where they are. For all we know, that car is all they have, right?
Or they borrowed it.
Or it's how they get to work. So what can we're all on board in this room, what can we do to be ambassadors of that message to help say, you need food, come get the food? Is it shortening your intake form? Is it saying, okay, I'll serve someone from a neighboring town? What can we do to make it easier? I know myself, I don't go to the grocery store in my town because it's not on my way home from work. So if you think about food pantries being grocery stores for people, they might not go to the pantry in their town because it doesn't work for their schedule. So just thinking about that and practicing that empathy, which I think everyone in this room does, and taking care of yourselves.
I think it's an opportunity for us to really start small in the state of Connecticut. I grew up here, I grew up in Madison, I moved away a lot, I work in the music industry. So my job's funky, but it's really fun. And it was the last one to come back after the pandemic. So I have had to pivot a lot. So I think in this little state of Connecticut, and I never thought I'd come back to, because it's expensive and I didn't want to, but it's beautiful and amazing. I think that we can start as like a local, like really local. Like we have a lot of local foods made here, distributed nationwide. We can start, where's the waste? Where could we bring it in? Where could they give a little? Where could we give back to them? Because it's all about reciprocity. There is a book about the service berry. It's called The Service Berry. It's a great book. And that's all I'm gonna say. If you like to read.
Thank you all so much. And I'm getting the signal that it is time to wrap this up. So I'll go straight to our last question. I know we've talked a lot about the challenges, and it's important to do so. But I also want to end this on an optimistic note. And so Caitlin, it's okay, I'll start with you. I'm just gonna go down the row. And if just really quickly, each of you could share, what is one thing that local governments and leaders in this room can do to help address this food insecurity problem that we've been talking about?
Out of a whole lot of possible options, I'll just point to the need to continue outreach and support for people in accessing services, including SNAP, and also other supportive programs we haven't even brought up. There's Meals on Wheels, there's Congregate Meals that happens right in this room, we noticed as we were preparing for the panel. So all of these programs, people need to know about them, and there needs to be a connection in ways to connect people to these resources. So with all of some of these programs in threat, let's not scale back on our outreach.
One thing is hard. I think I would say is use your voice and raise awareness about what you're seeing in your communities. We talk about it being a hidden issue. We all have the power to change that if we share in our circles and our networks what we're seeing and what we're experiencing in our communities, and more importantly, how people can help. If people want to help, if you run a food pantry, don't be shy about asking what you need, because often if you do, people will step up, but it takes you kind of raising awareness about what you need.
As legislators, as town electeds, we have to stay really close to the ground on the information to understand what is happening in our communities, so that when we are advocating for dollars at the Capitol, we can say these are the very, very specific needs. Just a quick for instance is aging and disability. There's a lot of money that comes from the federal government department for feeding seniors. And we just found out we have, I think it's a $6 million gap now that we didn't have before. And so ensuring that, when you set aside $500 million to address federal needs, that you are pointing, the camera towards, there's $6 million that's missing now from feeding our seniors in our communities. So it's really our job to stay as tightly connected to our communities that are actually doing the work so that we know how best to serve them.
I think less is more to start, and then from there we can build a really strong foundation. Mindful eating, other things around food, in conjunction to aiding to the insecurities around food and some of the fear around trying to access food. Thank you for being a part of our community and donating to the pantry. We appreciate it very much. Thank you for letting me be here today.
Thank you all for being here. Thank you for sharing your expertise, for being vulnerable. We've talked a lot about a lot of the challenges, and we do have a lot of them, but we also have a lot of strengths as a state. And I think the biggest strength we have is that we have so many amazing leaders who are doing the important work on this topic. And it's been an absolute honor to be up here with 4 of them today. So can we please give them a quick round of applause? And now I think that we have some time for audience Q&A at this point.
So we are going to ask people to use the mics just because we are recording this. So I will. If you could just introduce yourself and ask the question.
Hi, I'm Claudia Shada. I'm brand new to the state of Connecticut, and I'm a pastor at 2 Episcopal churches, one in Pine Meadow, St. John's Episcopal in Pine Meadow, and Trinity Episcopal in Collinsville. And one of my questions is, what does what we're saying about the Farmington Valley, what does that look like in terms of the state? What does the state look like compared with the area we're talking about now?
Sure. I would say relative to the state, the food insecurity rate in the Farmington Valley is slightly lower, but it doesn't mean it doesn't exist. There's some towns that have higher food insecurity rates in the Farmington Valley than others. But with that are different challenges. We know in more communities where there is less need that there might be less services and harder to access that help. Because, in Hartford, for instance, there's deep need, extensive need. There's also over 50 food pantries in Hartford that people can go to, and that's still not enough. But in smaller towns, it might be the town, all on the town pantry and town social services to meet that need. So it's different, I would say.
And some towns don't even have a pantry. I think most towns do, but we've had pantries that have shut down. I think that, the larger number you'll see about especially children who are affected by food insecurity, it's a much larger number statewide than it is in the Farmington Valley. But again, as Miranda was saying, you're dealing with an average, right, of all of these towns that are in the Farmington Valley Health District. So some are going to have a higher number than others, and so that may make the average look a little bit better in some ways, because it's like, it's really low in this town that has a larger population than this town that has a smaller population but higher need. So it just kind of depends.
And I'll note that we are referencing USDA data.
Correct. Current, well, whatever the last current data was.
Thank you. Other questions? Thank you.
Hi, my name is Renee Follett, and I actually drove 2 hours to come here from New York because I was so interested. Connecticut is the home of Katie Martin, who wrote an incredibly transformational book, right? So, I don't regret making the trip. This is amazing. Christian, your position, we don't have the same type of position in New York State, and I'm really interested in learning more about that. From a data perspective, I also wanted to offer, we've also been reliant on the Feeding American data, but there are other ways to slice and dice this. And I was really pleased that SUNY, New Paltz State University of New York, College at New Paltz, The Benjamin Institute recently did an affordability cost of living study, and they focused on food insecurity. And they found that only 51% of people in our Tri-County area have enough money to buy the food that they need. 49% of people in our community, they might not be in the 1 in 10 that Feeding America reports out, but when you start to really dig into the data, you realize so many people consider themselves to be food secure because of help that they're receiving. But when you really look at our community, 49% of people don't have enough resources for their food. So I would just encourage you to look to your universities to collect granular data. And Leah, oh my gosh, I mean, Representative, look to your left for all of your guidance, because that, I mean, every word you said today was like so spot on. It's about hyper-localism. When we had our SNAP crisis, our county executive, rather than going to the food bank, said to our community, what do you need? Released $150,000 a week for us to purchase from local farmers to be able to meet each community where we were at. So we didn't have to have 1,500 people at a food distribution. Everyone stayed in their own neighborhoods, and we delivered food every day with one truck and one driver to 300,000, a community of 300,000 people. So it's possible to look different, to do it differently too, right? Thank you.
That's interesting. Thank you. That was very kind. I just wanted to reply to that. Thank you. And Rachel, I'm gonna call you out. And Rachel's been can I call you out?
Sure. You already did.
I just did. She's awesome, and she works at Simsbury Social Services, and she fights, and she asked me to be here. So my vulnerability has led me to, I think, a place that I need to be. So thank you. Let's do it.
Hey there, thank you all for coming today. This has been really interesting and appreciative, and your time is really appreciated. Just a thought here. You know, farmers are also struggling because of cuts in Washington, and those 36 trucks or 19 trucks that didn't come, are also affecting farmers. Has there been any looking into like a connection with the Department of Agriculture and providing, whether they're seeing where they're getting where farmers are losing funds and where we've got food insecurity, and making that connection, from an economic perspective for the state of Connecticut, but also supporting farmers, but also supporting everybody in this room and those in need. So the $10 million bill that I had referenced for CTNAP, the goal was to have 15% of that go towards our farmers. So that would have been $1.5 million. So we're still pursuing that, and then also pursuing some other ideas around farms. I mean, certainly it's interesting because again, referencing Don Piccini, he has the container gardens at Connecticut Food Share. So it's a different kind of farmer, but certainly Miranda can speak more to the partnership between Food Share and farms. But it's very concerning because I believe initially, like right off the bat at the beginning of last year, they lost over $1 million in Connecticut to farms that were participating in various programs. And so we have to find more creative ways to do that. My hope is that the conversations that we have with DOAG this year sort of lead us into that direction. I actually chair the subcommittee on appropriations for conservation development. DOAG's under that. So we will be having ongoing conversations in terms of the budget adjustments about like what are the needs, because we have to be thinking more about that. And we certainly don't want our farms going under because, pardon the pun, we have a new crop of younger farmers that seem to be interested in doing this, and we want to keep as many of them in business as possible.
And it's hard to be a farmer. I have chickens and I love them, but they're a pain and I can't go away and it's not easy. Yeah, there's not that much offense, but it's like, it's tough, and I want to be in conjunction with the farms because I think it's like where it all starts. So, yeah.
And I'll just add, I really appreciated that question. As we're seeing all these changes in our food supply, growing local is going to be our answer. And a really important thing, Lenny referenced that we have hydroponics at Connecticut Food Share now. That's something we've been piloting, knowing that when people go to food pantries and kitchens, they're looking for produce, they're looking for fresh, and that's not something we've had enough of. So it's a great awareness on the importance of farms in all of this.
I just wanted to say one thing. My name is Maggie Dreyer. I'm the Director of Nutrition Services for Avon Camp Schools. And I just wanted to mention the Farm to School program where the Rudd Center is extremely, so we are trying to support the farmers and it's a great partnership with the schools. And then I just wanted to briefly mention the families that you just think may qualify or that, oh, they live in Avon or they live in Canton or Simsbury, they're doing just fine. When you look at the eligibility charts for qualifying for free and reduced meals, if you look at the Alice numbers, what it says, a family of four, I believe it's about 116,000 for a family of four. A family of four would have to earn less than, I think it's about $42,000 a year to qualify for free meals. So the eligibility chart is a federal chart, it's a national chart. And that's, I feel, I've been a director a long time, and I think that's one of the biggest challenges we have to support our families is that federal chart.
Other questions? I just had a quick question. Miranda, you had mentioned awareness. Yeah, I'll pass it back after. Awareness as being one of the big barriers to access. For the Farmington Valley Health District, obviously one of our big roles is connecting to services. So what is it that we can do to improve that awareness out in the community?
I think talking to people in your community and people who may or may not be going to your programs where they suggest that you promote and how you promote word of mouth and what I've learned in this space is probably the most powerful way that people learn about assistance. And it's not only there's a food pantry, but it's a food pantry and they'll treat you well. There's, you can apply for SNAP and they'll make it easy for you. And so thinking about that, we do have a flyer at the back table that Connecticut Food Share created actually during COVID, when we were, to try to make it easy for people to know, no matter where you are in the state, how you can get help with food. It has information on how you can apply for SNAP, how you can go to a food pantry, and what to expect. It's not just saying this is the pantry, but what we hear from people is, well, do I need a bag? Do I have to sign up ahead of time? What will the paperwork be like? So thinking through that, what do people need to know and to expect? And that's part of being trauma informed in the work that we do. There's so much chaos, there's so much going on in people's day-to-day, especially if you're struggling to make ends meet. How can we be as clear and transparent with people about that?
Also making sure they know in terms of awareness, like if they have applied for SNAP and it's not moving fast enough, that they can contact me, they can contact Mike D'Amico, they can contact any of their representatives or senators in order to make sure that it's, moving along, because, accidents happen, something might have gotten lost, or, just knowing that there are other people even beyond the food pantry that are willing to assist. But I think that awareness of, also you having the current correct hours and days of the pantry. That is such a problem with when folks call 211, and it is not 211's fault. If they're not updated on the website of whatever pantry it might be, it makes it really hard for them to give out the correct information. Or the pantry may have shut down, the pantry may have moved locations, just making sure that all of that information is accurate. That's true too.
And I'll just add one other quick tip. We've heard a lot about mobile pantry. It's a program of Connecticut Food Share. It's a no questions asked program. So if someone's new to asking for help, it's a good place to start. If you get your cell phones out, if you want to, text the number 85511, and we can do this later too. It will ask you for your town, and then it will respond with our mobile pantry schedule in your community. And so that's one easy way. If you learn how to do that, you can tell others how to do that, and that's how we spread word. It doesn't need to be hard to find help, but it's you all knowing that information as a starting point. 85511 is the number you're gonna type, and then you're gonna write the word food share in the text, or comida if you need it in Spanish.
So thank you all for, this has been really informative and really inspiring, and I really appreciate it. So I have a question. I don't know if I want to direct it to Eleni, or if I want to direct it to Christian, or maybe to both of you, or all of you. So obviously, you pointed out some of the real needs here. Awareness is important. Eligibility, increasing eligibility perhaps. Money obviously is a big issue, a big driver. So what is it? So this is a two-part question. What is it that the legislature and the governor need to do this year in order to improve the situation? And realistically, what is it that we will do? How's that for a question?
That's not even fair because he's my colleague. First part of the question is, we need to keep advocating for that $10 million because like I said, that was what the number was 2 years ago. It's probably higher than that now. And the governor has been responsive to Connecticut Food Share in terms of what they're saying they need. I also think, again, going back to, we can throw $100 million at Connecticut Food Share, it's not gonna solve the problem. And it also is, at a certain point, it needs to be consistent funding over time, not like, here's 50 million right now, best of luck. Like that's not how this has to work. It has to be consistent over time. The other thing in terms of really looking at, we used to have a Connecticut sort of SNAP program of our own, looking at that, ensuring that that is something that we are actually talking about. It is going to be expensive to stand it up, but to be honest with you, if SNAP goes away at the federal level, we're gonna have to do this anyway. So I think in terms of what are we actually going to do, that is still in flux because we don't know what's happening at the federal level. When we have a better sense of that, maybe starting at the end of January, there was some news last night about perhaps money that's not going to be coming to certain states and towns and cities. Like we are really going to have to be pivoting on, okay, are we trying this, are we trying that? I know that the commissioner of DSS has been actively looking at this for months. So it's not as if these conversations aren't happening. It's not as if they aren't trying to figure out, well, what would it cost to stand this up, or how would we do this? But I can't, and I will say, just, we're not being political. This is bipartisan. I can't tell you how many both sides of the aisle support feeding people. So I just want to make that clear. This is more in terms of a logistics issue and like how do we create this over time to ensure that we are serving our constituents the best way and our residents the best way through this incredible uncertainty and not even having the data now. So Christian could probably add more to that because he wrote the 70+ page report that we're going to hear on Friday. Friday.
Yeah. I think you nailed it. I think the main thing really is, funding's not everything, but it's a lot, and consistent funding is so important, especially because food insecurity, to be food secure, that food has to be there every day, day in, day out, no matter what. And I will also just note that it's a good investment. Food insecurity, there's one study that I love to quote, food insecurity is associated with an extra $1,800 per person per year in just extra medical costs alone. And that's not even getting to the negative impacts on child development, which affect our education budget, getting into the impacts on the future risks of housing insecurity, et cetera, et cetera. One thing that we're recommending in our report, and I'd be happy to provide a physical copy, one thing we're recommending in our report is creating a food and nutrition special fund in the state budget that would have dedicated revenue year in, year out, that could fund the $10 million for Connecticut Food Share, that could fund SNAP, but also, as we've talked about, because there's no silver bullet, it can fund a lot of different policies. One that I was talking about, the farmer question made me think about is New Jersey has a $40 million food desert relief program where they provide basically startup training, tax credits, technical support to help farms and grocery stores, food businesses start up in areas where there is no physical access. So that's something like that we could look at. But I think if that fund were to exist and have that year in, year out, I think that would go a long way toward making all the things that we need possible. And the other thing I would say in terms of just audit, because I know budgeting is difficult, especially in short session, information access is another thing that we talked about today, and that's something that costs not much money in some cases. We could take a look at food labeling, making the information more available to consumers. We could take a look at better supporting our teachers in schools to embed food and nutrition education. And that data piece. I think that data piece absolutely, something needs to happen. But again, I'll happily share the whole document, but I don't want to take up too much space from our panelists. But
I think you all made a lot of great points, and like we've been talking about today, it's very complex and it can't just be one answer. this is very layered, and it's not just the pantries or the food banks, it's also how people are accessing other assistance, other resources. It's our farms, it's our grocery stores.
Ironically, the waste, like that's what comes to me, like how much waste is happening. You know, like our portions, like just little tiny changes that could really actually put a whole meal on the table. You know, like some of the school lunches, those kids just throw them in the trash, no one's seeing them. I've worked in public schools, I have actually a BS in education and a BA in fine arts, and I've worked in schools, I know kids. We choose to homeschool my son, it's cool, we're doing it year by year, right buddy? But it's just the little tiny little things that actually could put another meal on the table, that could put more food out there. It just makes sense.
Okay, we're going to take a break. Thank you very much, and to our panelists. So I encourage you all to use this time to chat with each other. We did put some homework assignments on the table, so if you want to start thinking about those. Our second panel is going to start at 10:45, and we're really going to get into some of those solutions. What is being done in some of our community organizations and some of our larger organizations to address some of these issues. So please stick around, be ready to come back and listen again at 10:45. Thank you.
So we're going to get started. This panel really talks about what is existing in our communities, what innovative strategies are happening, and what can advocacy look like to really, make these changes that we had discussed in that first panel. So I'm going to hand it over to Christian. Thank you all.
Hi, everyone. Long time no see. We spent our first panel talking a lot about the different challenges that exist, but like we said at the end, there's a lot of really good solutions already happening, and we also have an entire panel dedicated to highlighting some that are happening right here in this region. And so I am going to cheat a little bit and recycle a question from the first panel. Because, we talked about how many myths there are in food insecurity. I just want to go down the row for starters. So Sarah, I'll start with you and ask you first if you can introduce yourself, and second, if you can share what you think one myth about food insecurity is that you encounter in your work.
Thank you, Christian. I'm Sarah Leathers. I'm the founder and CEO of a nonprofit right here in the community called Healing Meals Community Project. We provide healthy organic meals to families going through a health crisis. We serve those families for 12 to 24 weeks, but we also have a youth development program. Teens come into our kitchen every week, and they are learning how to cook, give back to their community, and really find their agency. So for me, this is an easy one. The misconception is healthy food is a luxury. Healthy food is a human right. That's all I'm going to say.
I have to say, I'm Sandy Flagg. I'm from Granby, and I'm the head of a program called Waste Not Want Not Community Kitchen. And we're celebrating 18 years this year that we've been doing this. So people used to ask me, people in the community would say, how many people that come to that meal on Wednesday night are really hungry or really needy? I've seen the cars, I've seen the clothing. And when they asked, I used to really worry about my answer and think about what this person was going to do with it. And then I found I was giving the same answer all the time. And I would say, every person that comes in that room is needy and insecure. And I am the most needy person that comes in the room. And my needs get met every week. I never know what it's going to be. And some of the things that happen stay with me forever. A person I interact with, a need level that's so intense that even I can't identify with it initially. But every week the affirmation is there. This is something that is worthwhile. It's meaningful. My time is well spent. And every person that comes in that room is so needy and their needs are so different. We don't meet every need every week, but we meet a lot of them and we identify them. And I carried that back with me. So it's the insecurity that brings them, and that's what we work on satisfying.
Good morning. My name is Julia. I'm the executive director of End Hunger Connecticut. We are a statewide anti-hunger organization. We do policy, advocacy, and outreach. We work with clients on SNAP applications and determinations. We do pantry support, farmers marketing, SNAP doubling. So if you utilize the farmers market, use your SNAP card. We are part of the GusNet program with Rhode Island, and we're able to match every dollar for dollar. Sometimes it's a $1 to $2 match if we have additional funding. The biggest myth, especially in my career field that we do policy, it's fraud. It's a two-part. One is that people are taking advantage of SNAP and using the system. In reality, only like 1.6% of it is fraud, and it's based on human error, to be honest. You know, maybe you didn't submit the form that you needed to. Maybe it wasn't documented right or calculated right. And the second myth about fraud is that undocumented immigrants are, utilizing the system, which is far from truth. But families with mixed status do participate because maybe they have an eligible person in their household, a child or an adult. So for our organization, debunking these myths, talking about it and bringing it to light makes a big difference at the work that we do.
Thank you all so much. Oh, sorry. So before we get into the content, I do want to talk a little bit about just the work you guys do on a day-to-day basis, because these are three really cool organizations that do awesome work for the community. And so I just want, could you just take a few minutes to tell us just about the work that's being done in your organization? And Julia, I'll start with you.
So as I mentioned, we do SNAP outreach. So our SNAP outreach is very different than what you get at a social service office. They're over the phone. You kind of talk to one-on-one with our clerks or our counselors to talk about if you qualify for SNAP, if you are eligible for SNAP. And then if you are eligible, what do you do? Where do you use it? How do you use it? If you need determinations, they're there to provide that kind of assistance. So you're not just applying for a program and left hanging. There's a more follow-back calls, making sure your determination went through. Maybe you missed your phone interview. So there's support as a whole person. And then additional, we do a lot of pantry support. So we try to do bulk buying. We've tried to meet grants or find entrepreneurs to help fund maybe pantry support. You guys get a lot of donations, but maybe you're missing a certain product, a dairy, a meat that you're not getting it. So we're trying to find this that is Connecticut grown, affordable. You can buy by bulk. Any way that we can help assist. That's our commitment there. And then with our farmers markets, farmers, they do amazing work. They're not getting paid enough to do what they're doing, and there's not a lot of support there. So we are part of the GusNet, which is a federal fund that for every dollar we spend with SNAP. So if you go to a participating market and you spend $10, you're going to get another $10 so you can utilize the produce. In certain farmers markets, we were able to work with the Department of Agriculture and do a true match. So we were also matching dairy, meats, ground beef. So we were trying to support the community at where it was needed. And last thing before I forget, because so much that we do, we're working now with grocery stores and entrepreneurs to also provide gift cards and grocery cards. One, it gives you buying power, it gives you dignity to go to the store and be like, hey, this is the items that I utilize, my culture uses, or I know how to prepare. But it also gives you a little wiggle room between your SNAP applications and, when you receive the actual card so you can utilize it. It doesn't cover, because SNAP is a supplement program. It's not a full income. It's not your full budget for the month, but we're trying to help cover these needs so you are able to go to the pantry, go to the grocery stores, and wait for your SNAP benefits to kick in.
So today's Wednesday, and that's my biggest day of the week. And we're cooking and we're serving a meal. And so it's nice for me to be able to do something else. But I got up at 5 this morning so that I could go to the kitchen before I got here and make sure that the things that I left last night when I left at 7 o'clock after being there a good long time, because Tuesday's a prep day. and Wednesday's the serve day. So our meal today is individual meatloaves and glazed carrots, mashed potatoes, and gravy. And then we always serve bread and butter, and we always have a beautiful fresh green salad and fruit salad. That's the menu, and it's always free, and everyone is always welcome. That was a question that somebody asked during the break. We don't ever turn anybody away, just like we don't ask for any identification. Everyone that comes in the room is welcome. And we do a lot of pre-stuff just to make it more desirable for people to get there. We serve in a church, in a fellowship hall, on big tables. It's not quite as big as this room and not nearly as lovely as this room with all this beautiful natural light. But we are so privileged to have what we have and have it for free. We don't pay rent, or we didn't pay rent until just recently. And we are able to do what we do because we're 100% volunteer, and we are so well supported, as I said before, 18 years. So there's a real benefit to being in the same place with the same name and many of the same people. I'm one of them that's been there for 18 years. So people feel more secure, and we have to do less educating and trying to get them to know that they can come here because we've been there so long. That repetition helps, that solidarity helps. And so we're serving now routinely about 120. We used to serve more, actually, but we serve that many hot meals, and then we distribute hot meals to people that are the homebound ones that can't get. I personally have several people to whom I bring a meal every Wednesday after I close up. And we support the mobile food share van that comes twice a month. And then because I'm retired and because this is the biggest driving influence in my life, I'm available almost 7 days a week. So if somebody calls in and we've talked about people that are new to food insecurity, they don't know the ropes, they might call because of what I just said, because we've been there so long. And they're not able to come on a Wednesday because it's big. There are a lot of people. I might meet them and start giving them from what we call casually the pantry side of what we do. And I might let them come privately on any day of the week. And I say that often. My card's out there. My phone number's out there. I wouldn't dare change it because so many people have it. And I might get a call saying, I need something, and I can meet that person individually and have them come in and do shopping of what they need and go through our resources. So we do that all the time.
So I started Healing Meals 10 years ago, and there's a woman in the room today, Terry Walters, who, she's so mad at me, who, when I kept telling her I was going to do this, because my sister started this in California in 2007, and I watched what she was doing. I saw her bringing teens into the kitchen. I saw the impact that she was having on our community when somebody was in a health crisis, and having a meal or meals delivered to somebody's home when that family is in deep stress and financial stress that comes with a medical crisis. I was like, I've got to start this here in Connecticut. And, I had a job. I wasn't looking for a second. But Terry and I knew each other, and, she finally said to me, what are you waiting for? Just cook a meal. And we go back, 10 years. Terry was there our very first day. We had 4 families that we served when we started, and 8 youth. And since then, we've served 238,000 meals to 75 towns in Connecticut, and over 700 youth have come through our program. And I think a lot of what Sandy is saying is it is so multi-layered in what we're doing. It is not only the meals that are going out to the families, giving them relief, having them not feel isolated, knowing that we are bringing them the most beautiful, nutrient-dense meals. If that person in the family who is sick, everyone's like, well, why do you serve everybody? Well, everybody in that family is under stress, and everybody in that family deserves a healthy meal. But it's also the volunteers. We have 120 volunteers that support us a week. They have become family, youth and adults together, working together. And so it's really, for me, is a core one of the core values of our work is everyone should feel better when they leave Healing Meals than when they came in. And I think that is what needs to ripple out to our community, is kindness and care for each other. However you're doing that in the community, just keep doing that. But over time, we started at New England Pasta Company, and we served 4 families. Every one of those families was dealing with cancer. Over time, the diagnosis that we are serving has obviously expanded. If we're serving as many people as we are, we're serving 90 families right now a week. And we did a mental health study several years ago with Mental Health Connecticut to look at, does our intervention, nutrition intervention, support somebody's overall well-being? 100%. It changed for those people. That feeling that knowing 120 people came together to support and make those meals changes people. We're now, several years ago, we did a pilot study with the city of Hartford looking at, could our meal support a low-income mom who is food insecure? There is a high rate of preterm births with food insecurity for moms. And I'm happy to say that we can share that 88% of the mothers are giving birth to full-term births, healthy birth weights, and very low postpartum depression. That is something that we're continuing because we saw that we are making not only a difference for that mother, but that child is coming into the world much healthier. We're doing a diabetes study right now with Hartford Hospital and their Food for Health clinic. Diabetes is a chronic condition in this country. There was a study done by Tufts School of Nutrition a few years ago that if everybody with a diet-related illness were to receive our medically tailored meal intervention, it would save 1.6 million hospitalizations a year and $13.6 billion in healthcare costs. I mean, just that alone, why is that not changing policy? So I'm part of a National Food as Medicine coalition. We have a national affiliate of the organizations that are doing the work that I'm doing, and we have started a Connecticut Food as Medicine coalition. So we are continuing to grow, and what we are seeing is the need is obviously growing. Somebody asked me once, have you saturated the market? And I said, wouldn't that be amazing? That would mean everybody in my community didn't need us. Guess what? That's not true. But that doesn't mean that we shouldn't be serving more than 75 towns. And so as we go into the next decade of Healing Meals, the goal is to serve all of Connecticut and provide satellite kitchens where young people can come in and share their gifts with their community. Thank you.
Thank you all so much. You do really exciting work. And I think one thing that really was occurring to me as you guys were talking is we heard in the last panel about how complex food insecurity is, how many different ways it affects families, how many different levels of need there are. But this is also the other side of that coin. The thing that makes me optimistic is programs like yours. You may not be reaching every single person, or you may not be doing every single thing for the person you reach, but every single organization is meeting a need. And I think that's how we ultimately meet all the need, is a bunch of different organizations, programs, et cetera, working together to make sure that everyone in Connecticut can eat. And so on that note, in terms of the needs that you guys are meeting individually, I wanted to ask what's working in your organization. What are the things that are working really well and you're meeting those needs effectively? And also, what are some of the challenges that you face as an organization? And so, Sarah, I'll start with you this time.
So I think I shared a lot of what's working. We are beautifully supported by our greater community. We do not have any state or federal funding, so all of our funding is coming from individual donations, foundations, and grants, and our corporate sponsors. But also what's working is we now have a really incredible network of referral sources. And so our referrals come from hospitals, social service agencies, word of mouth, school counselors. So we have really expanded that referral network. You know, for many years, and people still say, you're the best kept secret. Well, in the beginning, we kind of needed to be because we couldn't support everybody who needed our meals. And that felt terrible to think, somebody calls and we can't support them, but we're in a different situation now. So the fact that we are able to support everybody who needs our service, the fact that we're able to now expand, we're hoping to get a refrigerated van that will allow us to expand past our 75 towns. Those are all things now that I can look back and think, I never thought we'd be here, and look at what we've been able to do. The challenges, I think, are we have to do a better job of educating our legislators on the importance of food and the power of food, not just any food, quality food. I was on the state of Connecticut Elder Nutrition Task Force. It's the first time I kind of dipped my toe into that. And I don't even know what to say, appalled, maybe. Most of the organizations and legislators, most of the organizations were Meals on Wheels providers. I have a new appreciation for Meals on Wheels. When you are only given a certain amount of money per person to provide a healthy meal, it's impossible. They are up against so much. So I give them so much credit for what Meals on Wheels is trying to do. That's when I feel grateful that we are individually funded and we can make the choice. To Leah's point, she makes a choice every day about the food she's going to put in her body. I talk about with the young people that come into our kitchen, we have this captive audience of teenagers. We get to share with them how important it is to nourish yourself. Not just with food, but with spirit, and find joy and all of those things. That creates a healthy person. But, you know, one of the things I always say to the kids is, you know, if you could drive any car in the world and car was sitting out in your front yard and you were going to take it out, would you put tar in the engine? And of course, everyone would say no. And I said, well, that's just like your body. You have this incredible body. You have a choice of what you're going to put in it. And you can put really healthy things in it, or you can put really unhealthy things in it. And the more you understand what healthy food is and how it makes your body feel, the better actually you're going to show up for your friends and family. And I think that is one of the biggest things, is how do we educate everybody to understand food matters in how we all feel, and it doesn't have to be expensive. We have wonderful farmers, as Leah said, Thrive Farm and Holcomb Farm support us. We are so blessed to have them see us as somebody they want to support. That food gets picked on a Tuesday, and it is in our clients' homes, made into a meal on Thursday. Nothing is better than that. It is so nutrient dense. But we have to also be able to create opportunities for inner city situations where, you know, there are just bodegas, but they've got to have healthy choices. We have to be able to be getting people the food that's accessible to them. So I think I could go on, but I think that I'm going to stick with educating as many people as possible on the power of our food choices and how do we make that more accessible. And I think the more the legislators know that can help us change policy, that is a first step here in Connecticut.
Wow. A little bitty story. I have a supporter at Waste Not who brings me, and the first time was during COVID. She called and said, I have donations. And I said, I'll meet you. And she brought a carload. And it was all food that she had hoarded and pre-stocked, some of it dehydrated, had it all in nice jars and packages. None of it was expired. And I said, why are you giving this away? And she told me that she had a family member diagnosed with cancer. They are participants in your program, and the person is free of cancer today. And we have such a strong relationship with this family now, all of them. But they brought us food that they wanted to get out of their house because they didn't want to eat it anymore, because the whole family became so much more nutritionally savvy, and they weren't going to eat any of these foods, but they'd worked so hard to get it. They didn't want it to go to waste. So she brought it to a waste not. And I said, absolutely, we'll use it, because we always say that. And we were very glad to get it, because we don't have that pinpoint target. But I am so appreciative, and which allows me to say I'm very appreciative for being in this room today. I feel like I'm totally speaking to really the people who could do solos in the choir, not just preaching to the choir. I've been so impressed with that first panel and information. I didn't know I was going to be in a room with people who shared my thoughts and my feelings and my fears, but were so well spoken and so in position to do things about it. So it's been a much better platform for me than I realized being here today, and I'm very grateful for that. I just wish that everybody would take as much away today as I know I'm already taking. But what's working in our organization is being available, like the person that brought the things to us that was being gleaned out of her home. We do our meal in the menu that I told you before. We didn't buy anything for that meal. We did not buy anything, because it was all provided to us through a program called Retail Rescue, which we were fortunate enough, I think about 5 years ago, to connect. My memory's not always perfect, but about 5 years we've been doing it. We have volunteers, many of whom are never at the meal on Wednesday, but they go to grocery stores, the two Stop and Shops that are near us, the Fitzgerald's and the Big Y, and they get food from there and bring it back to us. And it's milk and it's dairy and it's yogurt. And on the days right before we serve our meal, it's fresh produce and fruit. And then the big thing, the high ticket thing, is frozen meat, because the grocery stores have to pull it from sales before the expiration date. So they pull it, it's flash frozen, and then we can pick it up. So we have to have, and thank goodness we're in a house that allows us to do it. We have so many freezers and so many refrigerators in which we store all of this stuff. So we might get 40 pounds of bacon, and then we get hamburger meat, we get steaks, we get things that we can use and things we can't use, which is how we evolved to a pantry, because we'll save the meat until we have enough to do. We'll save enough ground meat until we can do the meatloaves, which we're doing today. And so we have to be able to store it safely. And that's why we have to have so many appliances. And then there's some things that we get because we're not going to refuse anything from the grocery store when they're giving it to us, but we're not ever going to cook chicken wings and serve it. We're just not going to do it. So we want to give that away in a safe way. So we've modified our program so that we can give the things that we're not going to use away in a timely fashion, in a safe way. So we've done that now. We have people come in on Wednesday, and the first thing that we allow them to do is shop the perimeter of the room from coolers where we've just taken it out of the freezers and put it in a cooler where it's safely held, and they can shop and take those groceries home. And then later we have a little bit of a social hour to give a break between the two, and then we serve our hot meal. And at the end of the evening at 5 o'clock again, we open those coolers up for people who couldn't get there earlier, and they too can go through and get food. So if they can afford themselves that time and they come on Wednesday, they get to take bags of groceries, sometimes an amazing amount of groceries. And then they can have a little social hour with us and make connections. We've actually had non-English speaking people come, and we're teaching languages. People are teaching each other how to speak their native language, or coming so they can speak with somebody in their native language because they're so hungry for that connection. So What we are offering in addition to the groceries and the hot meal is a venue in which people can make that connection and restore their groundedness to their community. They can connect with people that speak a different language. They can speak to somebody who just had a child celebrate something. They can speak to somebody who just had a death and can relate to them. So it's you bring your stuff with you and you exchange it at the table. It's a little bit like magic, what happens. And, the way that we're able to do it and to do it now after so many years of not having the pressure of heavy duty fundraising all the time is because of this retail rescue. To be able to serve probably 140 people, sit down tonight and then take homes after. And then we've got stuff in our freezers that we collected. We did that at zero cost, and it's a beautiful meal. So to be able to do it is because we are in the right place at the right time and connected with the right people, and it's mostly food share. So that retail rescue is an invaluable tool for us, and it makes it all possible.
For us, we are a statewide organization, so we focus on policy and advocacy. What works for us is that we're not siloed to just one town, one county. We work very openly with partners organizations, try to work together and gather the facts. You know, Connecticut Food Share, they share how many people they're serving, you know, how many pounds of food they go out. For the women up here, they share the information, and we're able to talk to legislators, talk to municipals about this is what's going on in your community. We're not trying to change it. We're trying to just help you and support you. We don't come in trying to be like, this is the right way to fix food insecurity. We're trying to figure out what works in your neighborhood so we can carry it on to maybe to another person and provide that detail and that knowledge and education so it can serve another aspect of the community. With that said, one of the biggest challenges for us is usually, funding. So we are always trying to look for funding, trying to look for ways that we can partner so we're able to build maybe your program or Sarah's program. There has to be other resources that we have to share with our communities. We cannot work in silos. So COVID was a very eye-opening experience for everyone. You know, it allowed people to see food insecurity for what it was. So thanks to COVID, now we have funders who are funding policy advocacy. They're working with us to, you know, find other ways to help support besides relying just on food pantries. Like, what can we do to help the community? So for us, creating a new program, creating new avenues has been our biggest accomplishments in Connecticut.
Thank you all. So I know we're a little short on time, so I will now go to the part where I'm gonna start jumping around with questions to a couple individuals. So my first question is for Sarah. So we talked about Sandy talked about takeaways that people are coming away from today, and what I'm kind of hoping is that there will be some people coming away from this event going, I really want to start a new program to help fight food insecurity in my town. And I'm curious, what recommendations or advice would you have for someone if they're thinking that right now?
I think there's a couple things. One is understand your town. Really understand what are the needs. You may understand what you think it is, but I'm, really so grateful to the Farmington Valley Health District for the work that they have done on the community health assessment, really digging into that and really understanding. And then understanding, once you maybe there's a piece of that you're like, I'm going to really work on this. Then understand, are there organizations that are already doing this work? I think that's really, really important. I think, we talk about like not being in a silo. We have to partner. We have so many amazing organizations in the Farmington Valley in Connecticut. To me, it's how do we partner together? I do my thing really well, and Sandy does her thing really well, and Julie does her thing really well. I don't want to do what they're doing. I want to partner with them. I want to be able to take a client of mine who now, lives in Granby and say, here's where you can go next, right? Or a mom that we're working with in Hartford and be able to send them to End Hunger Connecticut. I think what you can do is really understand what is already happening, what are those organizations, and maybe start getting involved with them first to see, okay, am I able to make an impact here without actually having to start something? Let me tell you, starting a nonprofit, it's no joke. So it's a lot of work. After 10 years, it's still a lot of work, but it's the best job I've ever had. But there's a lot of ways to get involved without having to expend a lot of energy trying to get something started. There's so much that's already happening.
Thank you so much. Yeah, and I think that partnership is so important. So actually, speaking of partnerships, I want to zoom out a little bit. So we've talked a lot. Nobody can solve food insecurity by themselves. Everyone can be a part of the solution. And that's not just limited to the Farmington Valley specifically, or even Connecticut as a state. This doesn't exist in a vacuum. We have lots of neighboring states that have the same problems that we're having. And so, Juliet, my next question, I'm going to start with you. What would you say about, I was wondering if you could talk a little bit about like sort of the regional approach to addressing food insecurity and how some of those partnerships, both across Connecticut, different parts of Connecticut, and even across different states in New England, how that plays a role in fighting hunger.
So one of the examples for this, we work with Rhode Island. They are the carriers and the grantees for the GusNet program, which is a federal funded to help match dollar for every SNAP purchase. Working as a whole, as a group in New England is allowing us, one, to talk to other organizations about what works and doesn't work in their states. It's allowing us to see what changes, what do we need to be at the Capitol advocating for, lobbying for. It allows us to also open up funding that is stronger. So coming together as a New England based for a GusNet program guaranteed us 3 years of funding for our farmers markets. When you work in silos and you just work of Connecticut or based by county, you are excluding the actual damage that is happening in our state for food insecurity. So you can focus on, hey, our schools do not need school meals for all because our children are all school eligible, or they don't provide for this, or they don't need the need for this program. But when you work as a state or as a region of New England, you're seeing what works in New Hampshire, New Jersey. School meals are making a difference. Kids are going to school. They're getting better at education, testing, they're learning, they're not having medical issues, attendance. So focusing as a group, seeing what works makes us a little bit stronger. So we're not recreating the wheel. We're just making sure that that wheel is being rolled into Connecticut and we're building from it. They're able to share experiences, data. Data is a major thing that thrives us and, gets people attention. We might not have it. We might be lacking, but they're able to provide that, hey, in 2024 to 2025, our kids did this, this, and this, or we had enough families that were, SNAP and food insecure. Maybe you can use this to help project and see the future of what Connecticut's leading.
Yeah, thank you so much. I think that's really important, especially in a region as small as us. I know I meet regularly with my counterparts for Maine and New Hampshire and Massachusetts and Rhode Island and New York and New Jersey and learn a lot from what they're doing. And we can all just take the best of what works. And now I have a follow-up question for anyone who's interested based on both of those two questions. So we just talked with, Sarah, you were talking about how if you want to start something in your town, it's so important to know what already exists and who you can partner with. And Juliet, it sounds like that's kind of similar in the regional space as well. If you know what is out there, you can make these partnerships to pool impact. And so I guess my follow-up question is, what would be your advice for someone who maybe doesn't know where to look right now? Where can people go to figure out what's happening in their community, in their state, or even in their region?
My best advice is your backyard. Talk to your mayors, talk to your city councilors, talk to the people that work directly with your community. You want to make sure that you are listening to what the need is, before you act. You don't want to open a program that is not going to help. It's going to impair. You don't want to take funding from somebody else that's already doing the work. They just might need a little bit of support. And also focusing on the main person, which is the client, the person in need, making sure that the person is being met, is being heard, and all of their needs are being kind of filled. So you're not just food insecure in this life. You are risk of losing your house, your risk of, not having enough to pay your light bill, your medicine, everything comes together. So I think the main thing is not just to focus that, I'm here for food insecurity and that's my only focus, just making sure this person gets a meal every week or they're back at the pantry or knows where to find SNAP support, or it's knowing what else is causing those issues and working as a whole in the community, but mostly working with the people that are they're in the community. Your social service offices, they should have enough information, data, and they can tell you what is needed. So you're providing the dignity that the person deserves.
I just wanted to add to that because I'm grassroots level, as opposed to state level even, and multi-state for you. But one of the first things I ask anybody when they call and ask me for something in addition to food is, where do you live? And you need to connect with the Department of Social Services in your town. And I'm constantly saying that. And I know what happens in Granby, and I know the people there because I work with them a lot and we exchange. But I don't know for the other towns because we get people from Massachusetts, a lot of bigger cities. We have people that come from all over. So I have to ask that question, and somebody will say, somebody said to me the other day, I'm from Canton. She came to me on Monday and asked me to help her get a washer and a dryer because she's allergic to scents, very sensitive, and cannot go to a laundromat and cannot do laundry in a laundromat, therefore wants an individual washer and dryer. And she thought I could give it to her same day. And I had to say, I'm sorry, I can't do that, but let's go back to where do you live and it's not unreasonable. So you have validity to what you're asking for, but you need to go back and go through this chain. And so I'm constantly saying that. And today what I'm thinking is if something that could come from this is better ways to share information and to stay connected with each other, would take a lot of work off the table for a lot of us because many people do that sort of thing. So if we had a way to communicate better, agency to agency, town to town, I think that would be a great benefit because, as I said, I can work well with the town of Granby and I know the town of Simsbury, but maybe this woman was from Canton. I don't know them as well. So I always say go back to them first. And I then say, that doesn't mean I can't put the word out because word of mouth is so important. So I'll make a post, I'll make a listing, and I will share the news to people. Give me your name and phone number. I'm going to ask anybody that might have a used stack up washer and dryer. And those kind of miracles happen every other day. And somebody will say, I need to get rid of a washer and dryer. One of my favorite stories when I first started was one week somebody gifted us a huge amount of ice cream cones. And what in the heck am I going to do with all these ice cream? But yes, thank you very much. And we put them in a closet downstairs. And within 2 days, somebody called me and said, I have 10 pounds of assorted sprinkles okay. And I said, yes. And we got them. And so we had ice cream cones and we had sprinkles. And before Friday, the local ice cream parlor, we've had a couple that are just wonderful in Granby, called me and said, I have a freezer that's failed and I don't want to throw this ice cream out. Can you use it immediately? And it was like 3 hours before our dinner. Do you have a portable cooler? And on that Wednesday, we served ice cream cones with delicious ice cream that cost about $5 a scoop and could put sprinkles on it. And I incidentally had whipped cream already in the refrigerator. So these kinds of things happen where it all comes together. And maybe I'll get a washing machine and a dryer donated from somebody before the town of Canton could, but that was my obligation to tell her to go back and work your information chain. So I think the more that we know that and realize that and know what's out there, I think those kinds of communications are very important.
say one thing. Everybody in this room clearly cares. And so we already know we have this incredible group of people who want to make a difference. And the Farmington Valley Health District also cares deeply for this community. And they have created, this health assessment. If you have not read it, you should read it. I think that's a great starting point. And then you should call Jamie and Stephanie and meet with them and ask, what can I do? Sorry, you're going to get a lot of phone calls. You can call me too.
I'd also be remiss, especially because we're talking about all these wonderful resources that are housed in our towns and all the important work they do. I'd be remiss if I didn't quickly plug the food access guides that a lot of our towns have. So I always use Norwalk as the example of they have every couple of months it's updated. They have a 1-page document, maybe 2 pages if it's long enough, that basically here is all the food system assets in our town. If you need a food pantry, here is all the places plotted on a map. If you need help applying for school meals, here's where to go for that. So those, a lot of towns across Connecticut have them. If your town has one, I highly recommend using it. And if your town doesn't, I will say that my office is piloting a program to work with towns to build them out. So hopefully we will have more of those in the future. But I now wanted to pivot a little bit, again, to really echo something we talked about in the first panel. So we talked a lot about sort of all these factors that are driving food insecurity to these all-time highs. And I wanted to ask you all, from your ground level experiences, what are the things that you're hearing from your neighbors, from the folks who come to your organizations about what is driving them to need these supports? And I'll start with Sarah and we'll go down the line.
Well, mine's a little bit easier because every family we work with is in a health crisis. However, when we started to where we are even a year ago to where we are now, 90% of the families we serve receive meals for free. We have a sliding scale model. We actually started the sliding scale model after 3 years because we had families of means who would not take the meals because they said, oh, somebody needs them more than me. So they had the option now to pay a little something that would then support another family, and that felt better to them. But over time, what we have seen is our need gets greater and greater of the families who actually do need the meals for free. We ask people's household incomes. We don't question what they give us. Our client manager will get back to them and, say, okay, well, based on that, if it's not free, maybe you have to pay $15 a person. Our families receive 6 meals per person every single week. So $15 isn't very much for 100% organic food delivered to your door. And then it goes up from there based on your household income. If a family ever says anything, oh, that might be hard, then the meals are free. We never question that. We are just seeing a greater and greater number of families that are needing food. As we are working with a greater group of families with diabetes and our maternal health program, we are seeing that need also greater, and also how we have had to shift our model to better support those families. A couple of years ago, we saw that our maternal moms in particular, most of those moms are Hispanic, and so we now have a bilingual, bicultural community liaison. The reason our program is successful is because of Janelli. She works really, really closely with those families. Our meals are different than what a lot of families are eating. If a family's been eating 100% processed food and all of a sudden they're getting this organic food and they're like, I don't eat broccoli, or I don't know what this is, right? There's a whole education that we have to create for them. And that takes time and patience. And we want to make sure that that family over time is willing to kind of stay in it with us. And all of a sudden they'll let us know, wow, I feel so much better. So I think that's I don't know if I answered that right, but I think I just want to say we have just seen a huge difference over time, especially over the last few years, of how more and more families are needing our meals for free. And we want to be able to feed everybody.
I would just say that our ebb and flow is based on dollars. And we always are busier at the end of the month, and especially on a 5-week month, because people have less money then. The lightest week of the month is always the first of the month after people get their Social Security checks or their whatever it is that they get money from. And then we're seeing more people because they can't buy what they need at the grocery store. We address that a lot. The prices are so incredibly high, and people can come in and get beautiful fruit and vegetables that have been gleaned off of the counters at the grocery store, and they're getting it for free, and they're getting to pick their own. And so that's just an amazing thing. And we did have a huge reaction to the SNAP withdrawal in November. I had people calling me in a total panic, crying hysterically. And it reminded me of when people were doing the drive-through during COVID, when they were afraid to go to the grocery stores. And one elderly woman said, somebody told me my kids don't want me going to the grocery store. I can't even touch anybody. I'm afraid to go anywhere. And they told me to come here because you would give me food and I didn't have to get out of my car. And I said, of course we will. And we started just handing packaged things into her window in her backseat of her car, as we did during COVID. And that woman sat there and cried. She couldn't even go forward anymore because she was so relieved that there was some place she could come. She was an extreme example, but the people that were calling me because of their SNAP benefits, well, what am I going to do? What am I going to do? And all I could say is it's going to get fixed because it's everybody. So no, it's going to get fixed. We haven't crashed yet, but you can come here and get food. So you might have to get more free food rather than go use your SNAP benefits. People would call me and say, it's not the end of the month yet. I still have a SNAP card. What do you think I should do? And I said, go spend it. If I had a SNAP card, I would go spend every penny and buy things that are going to save. And the woman was saying, but I don't have any place to store it. Well, go under your bed, go on the top of your cabinets, go spend it and save it, and then know that it's going to come back at some point. And in the interim, you can come and have meals with us. And people did that. But it was that piercing insecurity and fear, which we're all living with right now, day to day. And now I know I'm going to start getting calls about the state of Connecticut and what's going to happen with federal money being withdrawn. People are going to be panicked. So I have a little bit more confidence after listening to our panel talk about it as to what I would say, that how we're going to deal with it, which is one day at a time and one meal at a time.
For us, our Call SNAP Center sees about 300 to 500 people per month. And the faces change and the needs change based on that call. So we have families calling in because there are mixed status, meaning one person in the household or multiple are maybe undocumented. And there's fear of going places because ICE. And it changes based on what's going on in the climate, the news. Another factor that's coming in is that, inflation. It's happening. Everything costs more money, but the cost of living is not actually going up. So your rent is higher, your grocery list is higher, your medication is higher. It makes it really difficult to budget and have families kind of decide, do I pay for my insulin today, or do I just eat a little bit less, or do I wait till the end of the month to buy my medication because I have food in the worries of food in the morning, like the early parts of the month. The biggest thing that we see is that depending on the culture, depending on part of the state, it changes drastically on what the need is and how people are dealing with or becoming food insecure. The stigmas are the biggest factors for us. People are afraid, they're embarrassed to go ask, I need help. We have neighbors and seniors that are very limited to traveling, transportation. They rely on the little buses that come and gets them, but those are token based depending on your town. So maybe they only have 20 days of transportation or 20 tokens a month. So it becomes a limit. It makes it really hard for them to ask for help, get help, or even find the help. But truly the faces do change every month based on what's going on in current situations.
Okay, all right, is it working now? Hooray! Okay, sorry. But thank you guys so much. I think you guys are really efficient. I think you answered both the next two questions in that. So, but yeah, I think I'd be remiss if I didn't note that echoes a lot of what we heard this morning. Of just there's these different things that are happening that are all contributing to this major uptick in food insecurity. And Julia, to your point, like depending on what's happening, you can go from food insecure one month to food insecure the next month. So I do want to make sure we leave time for Q&As. So we're going to go to the last two questions. So the first one, we've talked a lot about how all three of your organizations fill in some of the gaps that bigger programs like SNAP leave in the food security safety net. But we also know that gaps still exist. And so, Juliet, I'm going to start with you and we'll go back the other way. What sort of gaps do you see in your community or even in the whole state that have not yet been filled that need to be filled?
So my work is really different from a lot of people here. You have pantry support. You guys do Meals on Wheels and provide meals. My work is asking people to come forward and talk about policy change. Nothing can change if we don't change the laws and the rules, federal and state level. Feeding people, it's a nonpartisan issue. I mean, we need food to survive. It's a human nature need. So for us, the gap is working with towns across Connecticut to come and speak about what's happening in their backyard. You know, your town might be wealthy. Maybe you don't have a pantry. Maybe you send somebody else to a different pantry to the next town over. But maybe you talk about those things. You know, not everybody is wealthy. For every wealthy person, there's a person in need. We need to address that, make it kind of a conversation. It's not like, hey, we don't need your services. We don't need a pantry here, but let's have those conversations like, what can we do? Because we're wealthier to support a town or a city that is in need. So for us, it's bridging those communications, you know, having people from Litchfield, Fairfield counties maybe come out and talk on behalf of what they have or do not need and talk about why it's working makes a big thing for us. It makes our voices heard at the Capitol, makes legislators stop and listen. So like, okay, so maybe school meals, for example, everybody needs a meal. And the school meal stigma is that every child needs a meal to learn. And a lot of the pushback is that maybe that child comes from a wealthy town and they don't need a free meal, but there's a child there that does. So if we just take the stigma away and work together, get that voice heard, work together as a team, we can make changes in the policy world.
I think what we're talking about is what we've been saying all morning is communicating and a more open communication and addressing food insecurity or all the insecurities that tag along with food insecurity to make it a more open topic in every community, in every room. So talking about it, taking the social stigmas away. That would be my grassroots perspective.
So thank you, because Juliet's going to handle all the policy stuff, which is fantastic, because she's right. Like, and I said this when I started, we have to educate the people who can make the changes from first and foremost, but we also have to educate each other on the choices we make around food and why it matters that we're asking for healthier food choices and trying to get away from all of this processed food that is actually just making us a lot sicker. So there's a lot of education around that. The other thing that I think there's some gaps, Christian, is we're still fragmented in how we work together. We have our healthcare system, right? We have these amazing community organizations. And let me tell you, it took me over 2 years to get the program started with Hartford Hospital, just because, sorry, healthcare people, but the bureaucracy within the system. I literally am funding the program. I'm the little organization that's asking Hartford Hospital to just refer people to us and take some basic information. And it took over 2 years. So there's a fragmented system in what's possible of us working together. The other thing that we see, because we are also dealing with people in a health crisis, is there's a lot of people with dietary restrictions. And that is really, really hard when you're food insecure. That just makes people sicker. They don't have as many choices. I'm one of those people. And so it was really from day one to make sure that we're 100% organic, we're gluten-free, dairy-free, corn-free, and soy-free, and we can deal with almost any dietary issue. So it's amazing when people come in and they realize that somebody with celiac can actually get meals. They come to tears because there's no place. So that's a lack that we're doing too, is just awareness about dietary restrictions that we didn't see as much before, but we didn't have as much toxic food in our systems that was causing where we are today. So that's a whole nother issue, but I think that is a big gap as well.
Yeah, thank you all. And I will, as the person whose title is Food and Nutrition Policy Analyst, I will echo the importance of policy. And if anyone wants to come talk about policy, we're having a 90-minute webinar on Friday morning to talk food policy. But I will close us out here with one last question. So we've talked about the work you all do. We've talked about the gaps. Now I'm going to ask for 2 sentences. Because it's a 2-part question, because I got to be fair. I asked the same thing in the first group. The first part of the question is, what role can municipalities play to help fill these gaps that we're talking about? And the second piece is, because we want to end on an optimistic note, what happens if we get this right? And Sarah, I'll start with you.
No pressure.
I think what municipalities can do is make sure they understand who's in their community and how do they better support them. That seems like a simple answer, but I really think it is important. Really understand who do you have in your community and just ground level. And what would it look like? It's such a beautiful vision. Our vision at Healing Meals is a community where food heals. And I think we would be healed, because food insecurity is a basic human right. We should never even have this as an issue. People should be able to get healthy food when they need it, how they need it. The fact that we're even here is really sad in this country. So if we could take that away, that puts food on the table for people. They feel better. They can go to work in a different way. They can go to school in a different way. They can learn differently. They can love each other differently. It just creates a mind, body, and spirit of a person that really changes. So that's what I see. Is I see a world that is much kinder and caring of each other. And I do think it's possible. It's why I do this work every single day. I just believe in that from the bottom of my heart.
It makes me feel very hopeful to hear all this stuff. So I think that what the municipalities can do is listen and make a comfortable space and pathway so that they can hear, so they can receive the questions and they can hear them, and then they can give directions. So knowing your people is something that's already been said. Making a safe and comfortable way for those people to communicate with them directly, and then knowing the resources. It helps when we're small communities, because then it's very easy to know. And to whom do I send these people? And how are they going to be received at each of the different places I can send them? So I think that we do that pretty well in Granby, and I'm pleased to be able to say that. If we weren't necessary. If I weren't necessary as a food provider and somebody to whom all this stuff can be funneled, I would say that's going to make us so much more of a healthy community, which has always been one of our goals, to just be more family focused, more connected. And we have a sign out, which the Lions Club gave us a long time ago, and it says, be kind. And so some other people have said that today, just to have room in your heart, in your life, to be kind to somebody else. So that's what cements us as community. So I think that would be the most wonderful situation that we could ever dream for.
I think you guys covered pretty much everything. Data, share that information with your colleagues, your resources, social services. I think that makes an impact. And also keeping in mind, once again, person first. So instead, if a person's at a pantry at your site, picking up food, asking for help, maybe having the resources available all in one place so it's easy to track, easy to find. I can't stress that enough. You're already tired, you're overwhelmed, you're embarrassed to be there. So let's make it a little bit easier for this person to get the full assistance that they need. And if we tackle food insecurity, we're not just tackling food. We're tackling helping the farmers growing, healthy Connecticut grown products. We're helping our grocery stores economy. We're providing jobs. We're building more. So one problem does help fix the others. And that's what I think a food insecurity topic will bring to the table if we do address that.
I can't think of a better note to end on. Thank you guys so much. We've talked a lot about a lot of problems today, a lot of scary problems, and those are every bit as real now as they were when we started talking this morning. But there also isn't a doubt in my mind that we can get this right. And a big part of the reason is because there are so many people like you guys doing amazing work in every corner of the state. And I just want to thank you for coming up and sharing about your work. So can we give them a quick round of applause? And because I think this is it for me, I also just want to say thank you guys for letting me be here today. Thank you to Jamie and Stephanie for putting on this amazing event, and huge applause to them. I cover the whole state, and I have never gotten a chance to be a part of something quite like this. And I have already told other regions, hey, Farmington Valley's doing this. It might be cool to copy them. So you guys really are leading the way here. And with that, I think it's question time.
Any questions? All right, Leah.
Thank you. The three of you provided really insightful information for both my son and I and access to it. But Sarah, I have a question for you. How long has it taken for some families to adjust to some of these patterns of changes of eating, and also the pressures of social changes with eating, and then working with different walks of life and how they eat and culturally? It's a long question.
Well, I can't say I know exactly how long it takes a family, but one of the reasons we serve a family for 12 weeks is we know it takes time for change. And, you don't change when somebody gets you a week of meals. So we hear a lot, kind of week 7, week 8, where our client angels who call our clients, that's when they start to hear how much better people feel. I think what's unique about us and Sandy's doing the same work is that there's multi-layers. It's feeling supported. It's being able to say to a client angel, I don't really like peppers. And she's like, okay, that's great information. Or I don't really, something was kind of spicy. And we're like, okay, we have an opportunity where we can send you a really simple, more simple, plain and simple choice. Culturally, because we're serving 90 families, we can't say, oh, you get this and you get this and you get this. Everybody gets the same thing. And part of the reason for that is if people were to make their own choices, they would never try broccoli rabe. or the beet burgers. Right? And so it's about exposing them. We have families that have never had a fresh vegetable. And so that does take time. But then when they get a fresh vegetable and they realize, wow, they start to buy in. So there's a lot that we're doing on the education side. Every week in the meal bag, there is what I call a nugget of information that might be like, why is parsley good for you, right? I always laugh. I'm like, it's just not a garnish, right? So just the more we can educate them to the why, and our client angels are doing that also every single week. So we know that not everybody buys in. I just want to say that not everybody buys in. There are families that are like, nope, this is not for me. That's okay. We want to work with those families that are willing to buy in, because I feel if I can have that family on that program for 12 or 16 weeks, I'm changing a generation behind them, right? That family gets it, those children get it, and then they're going to do their best to continue.
I have a question. So we have some food pantries here and other nonprofits, and I was just curious if all of you could go into a little bit of detail, how it's been engaging with and doing outreach for volunteers, because I hear that is a challenge in getting volunteers in and, ensuring that if it's a food pantry, the hours work. So what has been your experience with people who aren't paid to do these things?
Can address that. I think it's an opportunity. So some people come looking for it. And I think I recruited a volunteer this morning when I came in because the question was, what do you do? And I can invite the person to come in and see so quickly. And one of the things that we do, and I think it's commonly done, is there's no lines between the volunteers and the people that come in. And that's one of the things that makes it work. So we all dress the same with the exception of a few Porsches and a few really fancy Mercedes, and then the car that needs to have its battery jump before they leave, which is why I have a battery thing there, because we have to do that so often. We come in different vehicles. We don't look at the vehicles. We come into the room and we all have the same status. So the lines are gone then. And so you can go and sit down and connect, and that can be the job you perform. And the young kids can take the trash out and carry the heavy things. And sometimes it's just that, to share, to connect. Sometimes it's to do dishes, and there are people who stand in line to take over that position after they've worked a full day, to come in and take off their work clothes and put on an apron, and they're going to wash dishes for the next 2.5 hours. There's something that makes them feel good about doing that. So that's what we have to do. We have to convince somebody that you'll feel good when you try it. So come in the door, see what it looks like, see what kind of job appeals to you. I say that to people all the time. You're welcome to come in any day. This is when we start. This is when we try to finish. Come in at some point in that evening and see what is happening and see what appeals to you, and then call me. If it doesn't appeal to you and you don't call me, that's okay. But if you see anything that sparks an interest, let me know, because we want you to help choose the job that's going to fit you best, not so much the job that we need to fill. Because oftentimes we have people standing in line to take those jobs. It's amazing.
I'm going to jump in. Since our job doesn't require a lot of volunteer services, we get requirements and asks from banks, from local businesses. If you guys create a flyer, materials, including it in your social media, we'll be glad to share it, pass it along. We get, maybe 3 to 4 asks per month to volunteer. One time becomes multiple times. There's one person's going to like what you guys are doing and how you're working with the community, and they keep coming back. So just share that information with us, or even on your social media page, and we will be glad to click and share and like it for you guys.
I'll speak mostly. We have a robust volunteer program. Every week, a volunteer email goes out at 4:00 on Wednesdays, and at 4:10, it's full. for the week. We feel very, very blessed, but I think we have created a community where people just like to be together. But from a youth, people ask me all the time, oh, how do you get youth to volunteer their time? And I always say, well, youth are voluntold. That's usually how we get them, right? It's a parent, it's a guidance counselor. I don't really care how they get to us. Our job from day one has to create a space that they feel safe, that they are welcomed that first time. We know how hard it is for anyone to go someplace new. So that first experience has to be really joyful and fun. But I think for what our youth are seeing is immediate impact that they're making. I had a young woman, our youth after 50 hours of service earn their blue apron, and after 100 hours, they earn their chef coat. We've had 160 kids earn their blue apron and 60 earn their chef coat. So they like coming and helping. But I had a young woman come after school to her shift, and she's like, you will not believe what happened to me today. I was at school and one of my peers asked me if I did healing meals. And she said, you know me, Sarah, I put my sales cap on and I was going to tell her how great it was to volunteer. And she said, before I could do that, she said to me, my mom got your note last night. So all of our kids write personal note cards every week to our clients. So that young woman realized that somebody she goes to school with is getting impacted by her showing up 2 hours a week. She is forever changed. So, every week we get thank you cards from our clients. And a lot of times they'll talk about the note cards that the kids wrote first. And when we read those cards in circle before every shift, you better believe that young person realizes they matter. And so that is, I think, also, right? It's different than when somebody does a program where they raise money, but you never really know what that money is going to. These kids are getting the immediate impact. So I think that what has created an environment that brings both our adults and our youth back, is understanding that they really matter every week and we need them and we can't do it without them.
Thank you. Any more questions? All right. So now thank you again to our second panel. And we're going to move into a
For over 40 years, SCM has been the voice of our town,
bringing us together through local programming,
education, and live broadcasts.
SCM isn't just about television.
It's about empowering our community,
ensuring our voices are heard during government meetings,
and celebrating milestones
like our high school graduations.
But today, SCM faces a challenge.
Our funding structure is based on television subscriptions. And it's no secret, people have been cutting the cord.
With a shift to internet-only subscriptions,
SCM receives less revenue,
even though all our programming is freely available online.
We need your support.
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 Your donation can make a difference.
It will ensure that SCM remains open,
continues to educate our youth, and keeps our community informed.
Thanks to SCM, I've been honing my creative skills, helping me work towards my college degree.
SCM is crucial for keeping our community connected.
SCM isn't just here to broadcast local events. They're actually preserving Simsbury's history.
Join us in preserving Simsbury's voice.
Simsbury's voice.
Together we can ensure that SCM continues to thrive
for generations to come.
Visit our website
or scan the QR code on your screen to make your donation.
Every contribution
counts.
Thank you for supporting Simsbury Community Media,
where your town,
your schools,
and your government come together.